And I think we will just start. I'm welcoming everyone to this webinar. As you know, our original plan was to host 2 conferences this week here in Reykjavik, Iceland, the Nordic Public Health Conference and the European Conference of Positive Psychology. And in the original plan, we had a joint day, which was today, on positive society, where we combine positive psychology and public health. As you probably know, both of the conference has been postponed, the Nordic conference to August 2021 and the European conference to end of June 2022. So instead of meeting face-to-face today, we are meeting out this webinar. And we have our first presenter here with us. That is Þórófur Guðnason. He is the Chief Epidemiologist here in Iceland. And he is going to present ways out of COVID-19, the view of the Chief Epidemiologist in Iceland. So the screen is yours, Þórófur.
Thank you very much, and I'm happy to be with you. Hopefully the technology is now working and everybody is hearing me and seeing the slides. I have titled my talk "Ways Out of COVID-19: Views of the Chief Epidemiologist." There are different ways how you can present the COVID-19, and but what I would like to do with you, if I get these things to work, is to present to you. I would like to maybe tell you how we in Iceland did prepare for COVID-19 and how we responded to the crisis. I will tell you a little bit about the current situation of COVID-19 in Iceland, future predictions, how at least I see the future here in Iceland. So my talk is going to be focused on Iceland. And then I will talk a little bit about the assignments for the next months and years to come, because we have a lot of things ahead of us that we need to do, and also the assignments the next days and weeks. So I think it's practical to divide it in those 2 groups, basically. So how did we prepare for COVID-19? I think we have had a success with the battle against COVID-19 in Iceland, and I think one of the successes is due to our preparedness planning. We have been preparing for pandemics, especially pandemic influenza, for a long time. I think our first pandemic plan was made in 2005, and since then we have updated and revised the plans regularly. And we just recently revised our latest plan. So we were quite prepared, and we have been using our plans extensively in our response to COVID-19. So our actual preparedness started in January, when we first got the message from China on this new coronavirus and the problems. And it was quite clear, I think, in January, especially late January, that this is a virus that would probably spread around the world. And in January, we sent a memo to the Minister of Health here in Iceland, saying that we needed to update our plans and we needed to prepare for the upcoming pandemic of the coronavirus. And we have a good legislation around our preparedness plan. We have Act on Communicable Diseases since 1997 under the supervision of the Minister of Health. And also under the supervision of the Chief Epidemiologist. So the legislation in Iceland is very favorable for us with regards to preparedness against pandemics. And we work very closely with the civil protection in Iceland. And that's also related and based on the Act on Civil Protection from 2008 under the supervision of the Chief of Police. The Chief of Civil Protection here in Iceland. So we use the same system here in Iceland for all kinds of health threats, whether it's a volcano or outbreak or earthquakes or avalanches or whatever it is, or pandemics. We use the same system, same actors in the response. So we don't have a special response plan or organization for different types of health threats. So that's very good, I think. Then you don't have to adjust and adapt to a new plan every single time you have a new threat. So the main aims of our response plan when we started in January was to quite clear that we needed to protect the necessary infrastructure in the society. We needed to protect the healthcare system in Iceland, and therefore we needed to flatten the epidemic curve as much as possible. And we needed to protect the elderly and vulnerable people. And we needed to prepare the hospitals and healthcare centers with having adequate stocks of protective equipment, essential medicines, and other kinds of equipments within hospitals, for example. And also we needed to have a backup personnel for the healthcare system in case our healthcare personnel would get sick. We needed to have a backup to take care of our patients. So we started this, and our aims were pretty clear already in January on what we're going to do. So this is what happened. Also, we worked with the University of Iceland, the computer scientists at the university, in making sort of a predictive modeling, so we could see what was ahead of us. And you can see here on the red line, on the red curve here is really, if we would do nothing, then we would have this type of a curve, the red curve. It's in Icelandic, unfortunately, and if we would do nothing, we would have an exponential growth in our epidemic. Our predictive modeling is shown here in the with a solid line, and the actual numbers, actual curve is a dotted line here. So the main thing was that we wanted to flatten the curve. We wanted to drag down the curve as much as possible to have minimize the impact on the society. And it's a combined effort of a lot of people, professionals, just the public, and all kinds of people, almost, I mean, everybody in Iceland. So this is what we did, and we managed to flatten the curve down to the actual curve that you see here. So the response, and what we did, the action was based on wide cooperation of a lot of actors, a lot of players, a lot of people, organizations, institutions, and based on the preparedness plan that we already have, based our preparedness and action based on distribution of all kinds of information to the public. We did that every day from the beginning of March. We had a daily informative meeting where we informed everybody on what was going on and what we thought might be ahead of us. We focused very much on diagnosing cases as early as possible, and that's why we did a lot of testing. We did more testing than almost every country in the world. There are some countries that did better than us in testing. And we decided initially that we would isolate all infected individuals, and we would do, we would follow them up. They were actually followed by a special care clinic at our hospital. They were called every single day, and they were called in for a checkup. So it was a very, I think, effective way of following up of infected individuals, and it's been very much appreciated by these patients. We did a contact tracing of exposed individuals. Right from day one, we had a team of contact tracing consisted of police officers and healthcare personnel that traced down every single individual that might have been exposed, and they were put into quarantine. And we did a lot of asked the public to do a lot of infection control measures like washing hands, social distancing, and so forth and so forth. And we got very much cooperation with almost everybody from the beginning. So this is the actual epidemic curve in Iceland. We can see that the first case here was in week 9, which is on the 28th of February. And what's unusual about this curve is that how rapidly it increased. Usually epidemics don't rise that rapidly, but it did anyway, and we reached the peak of the curve. This is a weekly number of cases on week 13, which is the end of March. And then what's also unusual about this curve is how steeply and rapidly it fell. Usually epidemics like this, they fell sort of slowly and reach a balance or equilibrium, but it fell very rapidly down, almost to 0 cases. So since the 28th of February, we have had 1,827 confirmed cases. We have had 115 hospitalizations. We have had 30 individuals that needed admissions to intensive care units. We had 18 patients on ventilators altogether. We had 10 deaths, which is a pretty low number, for example, compared to the Nordic countries. That's approximately 29 cases per million inhabitants of deaths. And I think, for example, in Sweden, I think they're up to more than 500. So it's unfortunate in many countries. Currently, we don't have any individual hospitalized, and we have had almost no cases now for several weeks. So I think we have been very successful in suppressing the epidemic curve, but this is at the cost of, we have a very low proportion of the population that actually has been infected, and we have done some antibody measurements, which means that we think that the actual prevalence of the infection is probably between 1% and 2%, which means that a large proportion of the Icelandic population is still highly susceptible to the virus. What's been going on now in Iceland, now that we have, I think, almost eliminated the virus within Iceland? Now, our greatest risk is from people coming from other countries, bringing in the virus and maybe triggering a new wave of. So that's why we have set up a screening at the Icelandic borders, both at the airports and at harbors. And we started that on June 15th. Before that, we never closed the borders in Iceland, but we required, before the 15th of June, we required that everybody coming into Iceland should stay in quarantine for 2 weeks. And of course, nobody goes to Iceland to stay in quarantine for 2 weeks, so tourism was very low at that time. But since we opened up with screening, we have had some influx of people. And since the 15th, we have had more than 10,000 tourists coming into Iceland, and we have sampled almost 8,000 people. And of those 8,000, we have found 2 infectious individuals, which have been put into isolation. And we have also diagnosed 11 individuals with old infection, which means that they are not infectious, so we don't do anything with them. We have not had any secondary cases from these tourists at the moment. So the big question for the future is, are we going to have another wave or next wave? People continue to talk about that and speculate on it. Nobody knows what's going to happen, because if we're going to have another wave, that's going to depend on a lot of factors. For example, we don't know how the virus is going to behave. Will the virus become less virulent? Nobody knows. Will we see seasonal waves of this virus? Coronavirus usually don't cause seasonal waves like influenza, but there are a lot of uncertainties about the virus itself that will limit or decide what's going to happen. Then the question is, will we get an effective vaccine? Nobody knows how quickly we will have an effective and safe vaccine on the market. I mean, the experience with vaccines in general is that it takes a long time to get a safe and effective vaccine on the market. So I think in my mind, that's not going to happen within the next month or even years, but hopefully I will be wrong on that. Hopefully we will get a vaccine that will be effective and safe, but we'll see. So then the question is, will we get effective medicines or treatment? At the moment, we don't have any good medicines to treat this virus. How is the spread in other countries gonna be? At the moment, I mean, there are more daily new numbers of infections being diagnosed than ever before. So there is no evidence that this virus is going down in the world, even though it seems to be diminishing or going down in many countries. So we will probably have this virus still spreading around in the world, somewhere in the world, for for the next 1 year or two, at least I would think. So the big question is, are tourists infectious? Nobody knows exactly. And that's why we decided to do the screening. We can speculate and we can argue and make cases, but we don't know. So that's why we decided it would be very important to do the screening to see actually how many tourists are actually infectious, so we can base our future decisions on the tourism on some real data rather than speculation. So we will have to be absolutely sure that the healthcare system in Iceland is adequate, the infrastructure in taking care of patients, for example, and then we have to rely on the personal infection control. How is the public in general going to behave in washing their hands, using hand sanitizers, using social distancing and so forth, because I think that's probably the most important factor in minimizing or limiting the spread of infections like this. But unfortunately, we can see some signs that people are sort of relaxing very much on this now, unfortunately. So there are a lot of things that will decide on whether we will get another wave or other epidemic within the next months or years. But in general, I think the widespread infection in Iceland is unlikely. And I think based on because I think we're on high alert, I think we have some experience from our first wave, and I think we can respond very quickly with effective measures. We know what works now, and I think we can be very quick in responding. So I think we might be seeing in Iceland some random cases, and we might see some small outbreaks in the next few months to come. So what's going to happen? What are the tasks and assignments for the next months and years? I think, first of all, we need to ensure that the progress we have achieved within Iceland, we need to maintain that. I would be very unfortunate if we would get an influx of new cases and which would trigger a new epidemic within Iceland. I would be very unfortunate, I think. So we need to make sure that the healthcare system is ready and on high alert. We need to be sure that the infrastructure in general in the society is well equipped and established. We will continue to test aggressively. We will continue to do contact tracing of all cases that have been diagnosed, find exposed individuals, put them into quarantine, and put index cases or patients into isolation. We need to make sure that the hospitals and healthcare centers are well equipped and ready to accept new patients. We need to have stocks of protective equipment, and we do have. All along we have had adequate stocks of protective equipment. We need to have stocks of essential medicines and parenteral fluids, and we do have those. But probably the main challenge will be to keep the vigilance of the public which means that have everybody stick to the basic measures on individual infection control, washing hands, social distancing, and so forth. That's going to be a great challenge, I think, to have people apply and stick to those basic rules. Currently, we are relieving mass gatherings. We never had to close the country, the borders. We never closed the schools in Iceland, except for we closed secondary schools and universities, but we did not close daycare centers and primary schools. And we did not do that because we felt that children are much less infectious than adults. And currently we have documents, and we have currently a research study waiting for to be published on that. Children are much less infectious than adults. And then the question is, can we control the influx of tourists or travelers in order to protect the Icelandic population? How can we do that? In my opinion, there are three ways we could do it. Either we can just open up the borders completely and have uncontrolled influx of tourists, and that's not an option in my mind at the moment, because I think that would probably end up by we would have a lot of outbreaks in Iceland, which could cause a lot of problems to our healthcare system. We can then, secondly, could have a complete closure. As I said, we have never closed the country, but maybe we could have some more restrictions to people accessing Iceland. I think that's probably not an option either. That would be very difficult to maintain for a long time. And in my mind, that's pretty much not an option. So the third option is to have some control over it. How can you control the influx and make sure that you minimize the risk? You can do that by making everybody go into quarantine for 2 weeks, but that's, as I said before, there are not many people coming to Iceland and staying in quarantine for 2 weeks unless they have to. We're still waiting for some international cooperation on tourism and traveling between countries, other than just opening up the borders. Some countries are doing bilateral agreements about traveling, like Norway and Denmark and Iceland, for example. This is difficult to do because it's difficult to get a good idea, good information, reliable information on the exact spread of the virus and what the risk entails. So this is bilateral agreement. This is more than sort of political issue than health issue, in my opinion. Then the fourth option would be to have some certificates. Travelers might be able to have some certificates, whether if they have had or been infected with COVID-19 before, if they have had a PCR test right before the departure to Iceland, or if they have had an antibody testing, for example. This sounds very good, but in practice it's difficult because there's no standardized certificates on this. It might be very easy to fake these certificates, and it could cause a lot of problems at the borders, how to read them and how to interpret them. So we have decided in Iceland we would not use or allow people to show some certificates at the moment. That might change later. So then the last issue is screening at the borders, and that's what we decided to do. Now we're screening everybody at the borders with PCR testing. And those that test positive, we do some antibody testing to see if they have, this is an old infection or new infection. The capacity that we have currently, we have 2,000 tests per day, but we plan to increase that up to 3,000 tests per day. There are basically one company in Iceland doing those screening. It's Decode Genetics, a private genetic company that does this testing, but the virology laboratory at the University Hospital is sort of gearing up to be able to overtake this screening. We have also used the healthcare centers to work at the borders. We need to have a very good information to tourists. We ask them to download an app, tracking app, with information, all kinds of information about Iceland, how to behave, and so forth. We need to have facilities within Iceland for isolation and quarantine if we test somebody positive and have to put people into isolation or quarantine. But however, this screening method is not 100% reliable. There might be some, because there might be some people testing negative, but still carrying the virus. It's possible. So what we say that this procedure, this screening is minimizing the risk of introducing the virus, but doesn't prevent it completely. So in summary, I think that this is the fight against COVID-19 will, in Iceland and like other countries, will continue for months. I'm not sure exactly for how long, but I would say probably a year. A coordinated approach is important. We have to have a plan. We have to stick to the plan. We have to evaluate what we're doing and then reevaluate what we need to be doing. We have to ensure that the progress that we have achieved within Iceland will be maintained. But at the same time, it's very important to get the economy up and running, and tourism is a very important part of the economy in Iceland. So that's important to get that up running. So we have to sort of get the balance between the health issues and the economy issues. But the most important challenge is really to maintain the individual infection control measures in Iceland. Like in any other country, we have to remind people that they have to stick to the basic rules of infection control. And if they do that, I think we will be successful in minimizing the spread in our country. Thank you very much.
There are a few questions from those who have been watching. One is about how you diagnose those with old infection. I think you explained it later.
Yes. What we do is that we do the PCR test, and if it's positive, there are some signs on the test that indicate that whether this might be, it's called a CT number, which indicates whether there's a new or an old infection. But however, we do blood test and measure antibodies against the virus, and if the individual does not have any antibodies, we label that as a new infection. If the individual has antibodies, we say it's an old infection and they're not infectious, because we can still diagnose the virus in the nose of individuals for weeks after the acute infection, or maybe sometimes months.
And there's a question about PCR screening on entry and quarantine until results.
Yes, we say that if people coming to Keflavik, they will probably get the results within 12 hours after they come into the countries. In other places in Iceland, might take a little longer, might take 24 hours. And we ask all people to go basically into quarantine, to take it easy, stay at home as much as possible, stay within their hotels, for example, until they get the results. And they get the results with the app that they download at the airport. And they can also get it with SMS, and they can also get it by contacting us through the email.
And the last question: certificate of previous COVID-19 infection could be problematic. What about false positives? This is more like with low prevalence.
There are very few false positives. Usually, we're more concerned about false negatives. False negative testing. This test is usually not false positive. So if somebody has the symptoms and tests positive, that's a pretty accurate measure of that the individual has the COVID-19.
Okay, thank you very much for joining us. I know you have a meeting right away.
Thank you very much, and have a good meeting. Thank you. Bye-bye. Yes.
So then we'll go on with the agenda. That was our first one, and then we'll go to Italy. We will give the screen to Marta Bassi, who will talk about positive mental health matters, health workers' response to the COVID-19 pandemic in Lombardy. Marta is Associate Professor at the Università degli Studi di Milano in Italy. Marta, the screen is yours.
Thank you very much, Dora. I cannot share my screen as long as the other participant is sharing. Oh, great. Good. So here you go. Can you see it?
Yes.
Yeah, good. So thank you very much for organizing this meeting, Dora. Unfortunately, we cannot be in Iceland, and for a long time, probably we're not going to be able to go. But in my presentation, I'm going to talk about my region, Lombardy, the region in Italy that is bearing the heaviest brunt of the pandemic. I'm going to talk about health workers and their mental health. I'm talking about professionals who were in the front line in facing the pandemic. And I'm going to talk about a specific time of the pandemic in Italy that was soon after the pandemic reached the peak and the numbers of hospitalized patients were going down. At that time, health workers were starting to take a breath, but to give you an idea of what they have faced and Italy has faced, I'd like to share some basic facts with you. Maybe you watch some of them on TV, but we have seen them live. So this is the background. First cases was reported on January 30th in Rome. There was a immediate declaration of state of emergency and the constitution of a technical scientific task force trying to prevent the spreading. Unfortunately, the spreading kept going and it reached Lombardy on February 18th. The first case of secondary transmission was registered in Codogno. And from then on, there was a kind of time race to contain the contagions. So February 23rd, we started to have red zones. So areas where there were viruses outbreak and that were closed. And from March 8th to May 3rd, we had a gradual complete lockdown phase that were reached by mid-March, meaning that we Italians were not allowed, of course, or were advised to stay home, to wear, when going out, to wear masks and gloves, of course, to reinforce social distancing. And at the very, let's say, heart of the complete lockdown, people were not allowed to go away from their home from 200 meters. And again, they were not allowed to go out of their hometown. So it was a very, let's say, momentous period for all of us. And in particular, it was for healthcare workers, the topic of the presentation. Just some other figures you can see here at the Lombardy, our region, with a population of 10 million people. And nationally, during from March 8th to May 3rd, there were 210,000 cases, and out of around 29,000 deaths, 49.3% were reported in Lombardy. So in this picture here, you can see the situation by June 21st, so recent picture, and you can see that numbers are still, that's the total numbers, and you can see that the provinces that were mostly hit were Milano, Brescia, and Bergamo. And what we can say that today Lombardy still reports 50% of the total positive cases in the country. So in hospitals, what happened during this lockdown period? Of course, hospital reorganization was revised, new COVID wards were created. We had to increase number of ICU beds. There were not enough beds for everybody. in the region, of course, and some patients have to be taken to other regions and also in some cases abroad to other countries. There was everything that the chief epidemiologist in Ireland was advised to have. We had shortage in protective equipment for health workers. There was shortage in equipment for patients, intubators, ventilators, and the working conditions were really extreme. Overload, exposure to biological risk, different professional tasks in the sense that some professional have to move to different wards to take care of different tasks, so they were not skilled for or prepared for those tasks, and of course lack of knowledge and treatment for COVID-19. There were also changes in private life, lack of rest, distance from family to keep, of course, contagious out of the family, and by April 28th, there were around 21,000 health professionals being infected and 200 of them deceased at the national level, and the majority of them were in Italy. So this is a photo that was published in national and I think also international newspapers, so you may have come across this picture of a nurse that is sleeping, literally sleeping on the keyboard at the hospital because of exhaustion. All these data were not meant to raise or stir your emotions, but to really stress the kind of overload and the conditions that health staff in Italy had to work during these months. And when we go to numbers, the numbers of hospitalized patients with symptoms, so the number of patients healthcare workers have to see during the period from March 8th to May 3rd, as you can see, is very high. We reached a peak of 12,000, more than 12,000 hospitalized patients. And since this line you can see here, from April 15th, you see the curve is, the numbers are slowly going down, and that's when we started the research. This is again another graph I plotted to show you the numbers of intensive care patients during the lockdown period, and again the numbers went up to 1,381, and it was slowly going down by February 15th. So if we look at the literature on epidemics like these or pandemics, there are a lot of international studies basically on SARS, MERS, Ebola, and some recent also studies on COVID-19, showing that under these conditions, the pool prevalence of, let's say, disorders among health professionals is very high. You can see here anxiety, depression, acute stress disorder, burnout, and post-traumatic stress disorder. And most, let's say, most of the studies focus on the personal and work-related factors that may predict worsened mental health, and they have identified female gender, young age, less job seniority, working frontline, and nursing profession. These are very important data, but we thought that actually three points had to be kept in mind. First is the time factor. Stress reactions are, let's say, natural and, of course, in many ways healthy at the beginning as a first at an acute stage. But it's important to monitor these reactions over time to see whether they keep stable, they worsen, or these stress reactions, let's say, draws back. We think that it's also very important to take into account country and regional differences. For example, in the previous presentation, we've seen that at least in terms of the epidemiology, Iceland fared better and at least differently from Italy. And the third point that as positive psychologists were mostly interested in was positive mental health. We know from the literature that high levels of positive mental health may protect from mental illness, and that low levels of positive mental health may represent a risk factor for worsened mental health conditions. So bearing all this in mind and trying to give a hand to our colleagues in hospitals, I work in a hospital with the colleagues that are involved in this study. So we wanted to, let's say, do our share, and we posed ourselves the following aims. First, we wanted to assess mental health of health workers in Lombardy during the second half of April. I said that's the last period of the lockdown phase that was characterized by decrease in hospitalizations. So health professionals were taking a breath at that point. And then we wanted to analyze the relationship between positive mental health and post-traumatic stress symptoms, not just focusing on socio-demographic and work-related factors. With these aims in mind, we generated an online survey. We sent an invitation letters to health workers that were actively working in Lombardy during the pandemic. This included physicians, nurses, health assistants, and professionals in rehabilitation and diagnostic activities. And the survey online included basically socio-demographic and work-related variables, an instrument to measure PTSD through the PTSD checklist for DSM-5, which allows to, let's say, to give a provisional PTSD diagnosis when the score at the instrument is equal or above the cutoff point of 33. And then we also administered the mental health continuum short form, positive psychologists are well familiar with, that measures well-being in its emotional, psychological, and social components, and allows us to have a categorical mental health diagnosis into flourishing, languishing, and moderate mental health. So we then went for descriptive statistics, percentages of participants meeting provisional PTSD and mental health diagnosis. We also compared scores based on profession and workplace. And finally, and most importantly, for our aims, we performed a binary logistic regression analysis with provisional PTSD diagnosis as outcome variable and as independent variables, gender, marital status, profession, job seniority, workplace, and positive mental health. So I now go to the results. These are our participants. 653 health professionals took part, voluntarily took part in our study. Mean age was around 43 years. The majority were women. And as you can see here, profession, the majority were nurses and obstetricians, followed by medical doctors, technical and rehabilitation professionals, and health assistants. Job seniority was, let's say, on average, or at least 38.1% of the participants had quite young job seniority. And they were spread into three workplace categories, what we called inpatient frontline, including acute care, emergency, infectious diseases ward, ICU, inpatient second line, including medical and surgical departments, and also outpatient and services second line that included outpatient departments, labs, and also family doctors. So here are some descriptive statistics. As you can see, almost 40% of the sample had very high post-traumatic stress symptoms that could be associated with a provisional PTSD diagnosis. And looking at the positive mental health side, around 58% had moderate mental health, 33.4% were flourishing, and 8.9% were languishing. When we compared professions, we saw that in terms of post-traumatic stress symptoms, nurses and obstetricians had higher scores compared to technical rehabilitation professionals and doctors. And when it comes to positive mental health total and social well-being, there were some slight significant differences, but no contrasts were significant. So the major differences were found for PTSS. In terms of workplace, again, we found differences in PTSS. We had inpatient frontline workers reporting higher scores than outpatient and services second line, but no differences in positive mental health. This was the heart of our analysis, the binary logistic regression, with provisional PTSD diagnosis as outcome variable and personal work-related and mental health variables as predictors. Here you see that participants, women were more likely to receive a post-traumatic stress provisional diagnosis compared to men. The same was true for nurses and obstetricians compared to technical and rehabilitation professionals, and to a slightly non-significant extent also healthcare assistant. Inpatient frontline workers were more likely to receive a provisional diagnosis compared to outpatient services second line workers. And most importantly, we saw that flourishing participants were more likely not to receive a provisional PTSD diagnosis, and languishing participants were more likely to receive it. So the first thing to start our discussion to bear in mind is that these are preliminary results. This was just the beginning of a longitudinal study we're going to perform. The second wave is going to take place in a couple of weeks, but we thought it would be important to share these results with the positive psychology community, bearing in mind the limitations of the study. First of all, it's a cross-sectional study, and then we have a self-reported measure for a provisional PTSD diagnosis. It's not a let's say performed by a psychiatrist, and there was no investigation of the DSM-5 diagnostic criterion A, so identification of specific stressors. Anyway, we think these results were quite important because it gives a picture of our healthcare professionals in Lombardy in a very delicate time when the gradual decrease of hospitalized patients could lead to the development of persistent stress responses. What we know is that there was a substantial share of our participants, 40%, that received a provisional PTSD diagnosis, and that let's say there was a kind of, we got different information from measuring the post-traumatic stress symptoms and measuring positive mental health. So we had a different pictures showing that, of course, let's say confirming previous data, women nurses, obstetrician and frontlines were more exposed to risk of PTSD, and differently from previous studies. In our case, job seniority didn't really help. The health professionals were unprepared to face the challenges post the epidemic. But most importantly, as said, we found that positive mental health may play a protective role in the development of post-traumatic stress disorder. Looking at the ratios that I showed before in the picture, compared to moderate mental health, flourishing individuals were almost 4 times less likely to receive a provisional PTSD diagnosis, and languishing individuals were 3 times more likely. This is we think that is quite a initial, of course, but important evidence to share with you, positive psychology community. We think this is very important for 2 reasons, of course. First, in terms of intervention, showing that intervention focusing on well-being promotion may facilitate restoration of positive functioning, but also reduction of post-traumatic stress symptoms. And secondly, I think this is also extremely important. This can help us plan ahead for a positive health system. Just imagine that the situation here is that there is, say, there are very high turnover intentions. There are, especially I know about nurses who are leaving their occupation because of the burden they have faced. And this is, I think, even more worrisome considering the economic situation in Italy and around the world. These people may be redundant and it's going to be difficult to find a different job, but they are giving up their current, let's say, job because probably, of course, one of the factors can be the burden that they have faced. And especially in the, let's say, in the same vein of the topic of the Icelandic conference that Dora wanted us to, as a vision for the future, to create a world we want to live in. I think these data could let us think or reflect on what we want for the health system of the future, what kind of health staff we're going to envisage in the future, and what kind of let's say, environment and working conditions we want to offer them. So this is, of course, just a question to start a discussion with. But I first, last but not least, I want to thank and present the research team that made this study possible. You well, positive psychologists well know about Antonella Delle Fave. And I also want to quote Dr. Roberta Cardi, who's a nurse at the Polyclinic Hospital, and Luca Negri, who's a postdoc researcher with us. And I think this a study like this can only be done when there is a research team and cooperation behind it. So thank you.
Thank you very much, Marta. It's very important to do research like this, and it's important to communicate the results to us. Thank you for that, and exactly agree with you. We are trying to build on these results, finding a way of how we create a world we want to live in, and we will continue discussing that and finding a way. Even though we're not meeting face-to-face in Iceland this week, we will continue and we will work on it, and that will still be the theme of the conference in 2022, and hopefully we will have more ideas and we have learned more from this crisis that we are going through, because there is often through the crisis that we learn the most valuable values of what makes life worth living and what is the most important. And we know that if resilience is important. Our next speaker is Professor Ilona Boniwell, the CEO of Positran and the director of the Master of Applied Positive Psychology program in Anglia Ruskin University in Cambridge and Paris. I would like to welcome you, Ilona, and you will be talking about resiliency, a very important topic, resiliency during COVID. So now the screen and the microphone is yours. Please share your screen with us.
Yes. Thank you, Dora. I would like to thank you for this invitation and the opportunity to contribute to this meeting today. I would like to thank you, Marta, for sharing your results, because these are really, really valuable results in the middle of crisis. And I would like to invite you to follow sort of another reflection, perhaps more focused on what can be done during the crisis. So Ilona Boniwell, I'm quite weird in terms of where I work, because I do work in England and in France and actually many different countries across the world. And probably what I'm going to present today is going to come from two perspectives, very much from a perspective that is a practical perspective and combined with an academic perspective. So I would say I'm an academic practitioner, and this is precisely the perspective I'm going to be talking to you about today. And I'm also, what I'm really passionate about is trying to make the change happen and actually affect something, hopefully in a positive way. So today we'll talk about resilience and importance of resilience under the current circumstances. We'll just try to define resilience briefly. We'll speak what it is, how it can be defined. I'll introduce something called Spark Resilience Model, the model of resilience we've been working for a few years. And more importantly, perhaps, I will introduce how this model and a corresponding program of resilience has been used in France during the COVID crisis, specifically during the confinement period. And I will share with you some very preliminary results of our resilience targeting intervention. And finally, we'll finish today by talking about the importance also of development of the resilience for organizations, and perhaps sharing some ideas of how resilience can be developed at the team level. So this is the program for today. So let's start. Why resilience? Why resilience? I think why resilience, it's a very good question nowadays, because obviously even before the COVID crisis, resilience appeared to be a very important notion in both individual and organizational functioning. Just looking at the depression data, for example, the anxiety data, at the data of people who are affected by overworked, resilience appeared to be a very important variable to consider. Obviously, in the middle of the COVID crisis, it seems to become even more important, because if we do look across the world, what we do see in different countries is a prevalence of depression, approximately going from mild to severe cases of depression, being at somewhere around 30 to 50% in many countries. So specifically, I'm currently living in France, and I'll be talking about the French example. French data, obviously very recent data, and during the COVID crisis shows depression rates rising to approximately 40%. American data, US data shows even higher percentage and higher rise, up to 49%. And thank you, Marta, for sharing Italian data as well. So in the middle of the rising depression, anxiety, and stress symptoms, what might be really important is to focus on how can we potentially prevent it? How can we potentially accompany people affected by the increased stress or distress? What I would like to also add before I jump into the whole resilience topic is that nowadays when the speaker is about resilience, what is sometimes very useful is to use acronym called VUCA, very famous in business circles. So if you are reading Harvard Business Review, I'm sure you would bump into VUCA every 2 or 3 pages approximately. But it's a useful acronym to summarize the currently changing world of work, and I would say the currently very fast changing societal condition. VUCA stands for volatility, uncertainty, complexity, and ambiguity. And volatility refers to the rapid rate of change. Would you imagine 6 months ago the world being in the state it currently is? Could we currently predict still the duration of the COVID epidemics? Uncertainty, we have a lot of lack of clarity about the present still and the future. So we still don't know how and why the virus has arrived. We still don't completely know the consequences, for example, financial, economic consequences. There are lots of relatively negative predictions as to financial and economic consequences at the moment, but yet we're still uncertain as to what's going to happen. Complexity refers to taking into account multiple key decision factors, such as will there be a second wave, for example, for possibility of reinfection, and ambiguity is basically the lack of clarity sometimes of the very meaning of the event. So VUCA is actually a useful acronym to describe current conditions and the current experience of conditions. And one of the responses to this VUCA condition, I would say, is notion of resilience. What's resilience? Basically, resilience is our capacity to adapt well to adversity and bounce back from difficult experiences, and we talk about metaphor experience of resilience that can be ranging from a flower pushing through the dry ground, or somebody running a marathon and just keeping going despite the huge exhaustion. And I would imagine many medical professionals were in precisely that state during the pandemics, and especially during the peak of the pandemics. Sometimes it's just about sort of holding on and not falling down, even under really, really difficult circumstances. And you can go up to phoenix rising from the ashes, or the notion of bamboo, which is a very common resilience metaphor proposed by people residing in Asia. Why? Because bamboo is a very flexible plant, pushing through despite circumstances and finding the way forward. Another metaphor I particularly like about resilience is this elastic metaphor, elasticity. Why this metaphor is so important is because actually they do help us to define the quality of resilience, because resilience is not necessarily just keeping going, it's also finding ways of keeping going. And these ways may include the development of higher flexibility, including cognitive flexibility. The benefits of resilience are multiple. When we are more resilient, we can see challenges as manageable. We have high emotional stability and happiness. We can cope with major stresses and daily stresses as well. We have more energy. We are more open to new experiences. We can help other people to feel good. And sometimes I would say, even I would agree with this citation, that more education, more experience, more training, a person's level of resilience will determine who succeeds and who fails. So what do we know about resilience? The evidence base currently of resilience comes from different sources. It comes from positive psychology. It comes from lots of studies on childhood resilience that started after the Second World War and continue up to now. The knowledge also comes from the literature on post-traumatic growth and existential psychology. Post-traumatic growth is our capacity. I would say it's almost like resilience with a big R. It's our capacity to find meaning in very difficult events that we have gone through. Cognitive behavioral therapy, that's sort of a practical and obviously research field that contributes enormously to resilience, because it provides to us very tangible strategies that we can potentially implement in order to enhance a person's resilience. And of course, the whole subfield of mindfulness recently has provided a lot of evidence over the past 20 years approximately, so not actually quite as recently, provided a lot of evidence that by learning mindfulness techniques, we can lastingly increase our resilience capacities. So I'm going to right now introduce a model of resilience and the corresponding program of resilience we've originally developed nearly 15 years ago in England, that we have now readapted, updated, and used during the COVID pandemics in France to actually try to intervene at a population-wide level, obviously with a limited number of people, to enable or to attempt to enhance the resilience of the population. So the model that we used and the corresponding program is called SPARK. SPARK is an acronym. SPARK is that I'm going to present in a minute. That is both used to describe the cognitive and emotional functioning of a person, of anyone, in fact, facing a challenging situation or a stressful situation, but it's also an acronym that allows us to organize different strategies that are currently known to enhance resilience, and actually to teach the strategies, and allowing us to also optimize potentially the memory and utility of the strategies. So SPARK model, basically, as I mentioned, is an acronym where S stands for stress, basically facing any stressful situation. What's happening? A stressful situation may be a situation where we are finding ourselves in having to work 12 hours during the pandemic. Stressful situation may be discovering that somebody's job is on hold and not knowing if this job is actually going to come back or not. A stressful situation maybe is for somebody who is a business owner, is discovering that their whole business activity has stopped without, again, any certainty as to whether it's going to return. So P is perception, or basically how we interpret the event, how we make sense of the event, which would color, shape, and determine afterwards the way we feel. So not knowing what's happening with your job or business, you might actually have a perception of, oh my God, this is a disaster, and I might never continue my business activity from this point on. Or perception may be, that's an interesting challenge, a difficult challenge, a really difficult challenge perhaps. What can I do to respond to it? So A is affect, is basically what we feel and experience on the inside, as the emotions and feelings provoked, not necessarily by the stressful event itself, but by our perception interpretation of it. R is reaction, this is what we do, it's an observable behavior. And knowledge at the end is what we walk away with, is what we actually learn from the experience, the construction of our mental meta schemas. So the SPARK model, just to summarize, talks about stressful situation, perception, affect, reaction, and knowledge. And this very model is used to help people to interpret the current situation and understand the role their perception might be playing in the situation, and therefore potentially the strategies they can use to challenge their immediate perception. But also this is exactly the model to help people to really learn lots of different strategies to develop more flexible perceptions, also just to go further, to be able to regulate their affect, basically to intervene at the level of their emotions, to be able to regulate their reaction, and also strategies that enable or that contribute to the meaning making. So the strategies that we talk about would include lots of different cognitive strategies at the P level, at the perception level, strategies such as disputation, distancing, reframing, decatastrophizing, or cognitive diffusion. These are well-known and well-researched strategies that have been shown to really contribute to the development of resilience. Strategies at the emotional level would include strategies such as affect labeling, the importance of giving names or attaching names to the emotions they experience, disclosure, verbal or written disclosure, depending on the circumstances and on the appropriateness of the verbal disclosure, for example. Strategies such as mindfulness and meditation that we know have a huge influence, and because it has been well established, that have a really strong influence on the development of resilience, but also strategies of self-care, such as sleep, exercise, and nutrition, and engagement in flow-like activities that actually serve potentially as a distraction immediately, but also as a source of positive emotions in the long term. Behavioral strategies, which are strategies that include exposure, because again, if you look at the data at the moment, we would find that a large proportion of the population, again, different countries, the numbers are different, up to 30% in France, for example, and up to 60% in the US have reported fear, simply fear to walk out, fear to interact with others, fear to expose themselves to the possibility of virus. So here we're talking of exposure. It's one of the strategies, basically gradual exposure, when we take into account the precautions to actually expose ourselves back to interacting and to engaging, re-engaging with physical life. So, for example, in our intervention groups, we'll talk about this slightly later, we actually had many cases of young people being very, very, very scared of exposure to virus, up to in choosing up to 3 months total isolation with absolutely no exposure out of fear. So strategies that they're teaching and that are important to enhance the reaction of behavioral strategies would be exposure, active avoidance, the importance of social connection, the importance of assertiveness, and also goal orientation. And finally, the final category, we're calling it meaning strategies, include strategies such as development of flexible mindset, acceptance of change, stress inoculation, meaning making, but also the importance of development and awareness of one's strengths. That's what they're calling knowing who you are, and the use of strengths during the difficult situation. So Spark, as I mentioned, can be used as an explanation model, can be used as a strategy organizing model, and also it can be used very much as a coaching model, which is what we actually do during the program, is we teach participants how to put Spark in practice in order to both analyze what's happening with them, but also to find different solutions depending on where the difficulty may be. So what is a PEEP solution that can be put in place, A solutions, R solutions, and K. So the reason I've been talking about the components of the intervention and the strategies is because during the COVID, we had an opportunity to put the model to test. I mean, it has already been tested in previous research studies with children. And nowadays, we actually adapted the program for the use with adult populations. And we also adapted the program for online delivery. So what we did, and I think most of positive psychology researchers and practitioners try to do something during the crisis. And I think when you're doing something, it's probably best to try to do something that you know what you are doing, or contribute with something that you can contribute with. In our case, we try to contribute with our knowledge and experience of teaching resilience. So we have run a trial, during April this year, a free trial, obviously a free program, when we offered free participation in the Spark Resilience online program to a limited number of people. So we had about 300 people apply within a couple of hours. 220 people have started on the program, and we had approximately the same number of people in the waiting list control group. These people are going through the program as we speak right now. So the program, the Spark Resilience program, has been delivered online over 8 sessions of 1.5 hours each in groups of approximately 100 people. 100 people varying between 100 and 120 people, 2 groups running in parallel. So what we have found is that the participation in groups remain very constant, and almost the same number of people stayed with us until the end. So a proportion of these people completed the questionnaires before and after the program, allowing us to collect the data. Why proportion? Because the data collection was not an obligatory condition of participation in the intervention, in fact. So what we have done analyze the data in comparison with the waiting list control group, and we have found quite positive results. So we have measured resilience, positive affect, meaning, perceived stress, but also negative affect and work engagement. And we have found that all of these factors have actually, on all of these factors, we have achieved significant results. So resilience went up in comparison to the control group, positive affect went up in comparison with the control group, the meaning and the experience of meaning went up in comparison to the control group, and also perceived stress went down. Similar situation, I'm just not showing the data here, happened with the negative affect. So negative affect decreased significantly, and work engagement approached significance. So the results are not quite significant in work engagement, but the tendency is there. So people who have participated in this intervention have actually demonstrated almost significantly more engagement. Why is this important? Because this type of studies would demonstrate that it's actually relatively simple and very cost effective to try to propose resilience enhancing programs and strategies online. Under the conditions of COVID, under the conditions where face-to-face teaching may be difficult and sometimes not impossible, this is one of the solutions that can be used to actually develop and therefore maximize the possibility and probability of developing positive mental health during situations such as COVID. Importantly, we have also, that's more coincidental, we have also found that there was a lot of interest in this type of programs. So we virtually received lots and lots of, something like nearly 300 applications within less than 2 hours, almost immediately upon communication. 1 day later, unfortunately, we could no longer accept participants. So again, what the experience has shown is that there is a demand for this type of programs. There is a demand, which is an open demand, and there is a very engaged participation as well. So I'm going to talk a little bit further and again talk about another experience that we trialed during the COVID pandemics. Now, for this experience, unfortunately, I will not be able to share the data. This is really based on working currently with organizations, but I will be able to show some practical examples and practical strategies potentially of what we can do to accompany organizational resilience at the level of teams. So I'm going to show some ideas and share some ideas about how we can potentially accompany team resilience. Of course, when we look at organizational resilience in general, we'll find in the literature that a lot of the strategies would rely at individual, would rely on strategies at the individual level. So we'll find exactly the same components and exactly the same strategies for individual resilience being also communicated at the organizational level. However, there is also emerging literature that shows that the aspects of resilience specific to, for example, team functioning, and the Spark Resilience for Team model summarizes some of those literature findings, some of those factors and corresponding strategies for the development of team resilience. So again, the model is a theoretical model in this respect. However, the actual components are very much literature-based. So facing stressful situations in the work context, very often individuals are not alone. Individuals work in teams. As we have seen during the pandemics, many of teams have found themselves working at a distance, having to communicate and interact and function under very different conditions, and therefore perhaps relying on certain other factors over and above their usual functioning. So what are the factors that contribute to team resilience? According to the literature, some of those factors are common mental model. Common mental model meaning what? Meaning that each member of the team has a model of what other members of the team have as their roles, responsibilities, and the ways of interaction with one another. This is their mental model of teamwork. And this mental model helps them to coordinate effectively, predict one another's behavior, and make decisions collectively in a relatively fast fashion. What's really important with this common mental model is that it is accurate. So my mental model with respect to somebody else's behavior is actually accurate with regard to their behavior, and their mental model with respect to my behavior is actually accurate as well. So the accuracy of this mental model predicts the speed of response and predicts the interpretation of challenges and tasks arriving on the table. What's also important, what's coming, also another important factor at the level of literature, is improvisation and creativity. Is basically being able to think out of the box. And again, the higher the level of improvisation and creativity there is at the level of the team, the more likely that the team is going to react in a resilient manner. What is further important, and here we're talking more about affective factors, is something that's called psychological safety. A resilient team members trust one another and they feel safe. Finally, basically, the team resilience is enhanced when members would share the belief that it's actually safe to take interpersonal risks in their teams, such as suggesting their perhaps creative ideas, without the fear of being criticized or being singled out by another team member. Another aspect that's important, and that's coming from the literature on affective rituals, is actually having some affective rituals. Affective rituals. What is affective rituals? Affective rituals is what we do at our team level. What we do is something that we do that's specific to us. Think about New Zealand rugby team and their haka ritual. Okay, that would be an example of affective ritual. For example, many resilient, that's an interpretation at the moment, teams during the COVID crisis would have a very a recurring affective rituals, such as having a drink with one another or sharing an apéro, basically sharing a little meal with one another whilst communicating and interacting remotely. So rituals such as this. What is another characteristic of resilient teams is something called resourcefulness, because an emerging demand for teams is the need to do more with less. Regardless of the industry, the expectation of deliverables are not often balanced with resources. So very often we'll find ourselves in a situation that the budget and the staff is not sufficient. So resourcefulness is basically being able to find solutions to how to reallocate resources in order to maximize the efficiency, overall efficiency, efficacy at the collective level. What's another factor that's important is relationships. Relationships, good quality relationships within the team, and also relationships that go slightly beyond just the team, sort of work team interaction, sort of knowing what's happening at home, knowing what's happening in personal life, relationships that are going slightly beyond work. And the final two factors are the shared vision of where we are going together, knowing where we are going, the objective, etc. And also something that's called collective efficacy. Collective efficacy is basically being able to effectively complete tasks together. So it's not just relying on one's own abilities or having confidence in one's own individual abilities to be successful. Team members in resilient teams actually collectively believe that they can effectively complete tasks that require different types of inputs from different people, from different members of the team. So specifically on this collective efficacy, I would like to expand a little bit more, because during the COVID, during the confinement, during the establishment of flexible working conditions in different cultural and organizational contexts, we have been working to accompany quite a number of teams to increase the factors contributing to their team resilience. So I've been accompanying teams at the level of how to adjust and adapt to different working conditions, how to work more effectively together, and how to perhaps really to optimize this resourcefulness and collective efficacy. And I think the very important point that we have learned is really the importance of strengths coordination in order to optimize this collective efficacy. So we've been doing a lot of team coaching specifically around optimizing their collective efficacy via their strengths. What does it mean? Again, teams, it's not just sufficient to have an accurate mental model, which is also important, of course, of what the other person is able to do. What is really important to optimize this collective efficacy is actually to allocate new and changing tasks to the person who is the most appropriate person to actually take this task on. How this can be allocated? It can be allocated only if we are really clear individually at the level of team, what are the best strengths of each individual team member in order to optimize our overall efficacy. Because one of the problems with strengths is that we have a lot of advice that it's important to play our strengths. What do we do if we are individually facing a task that corresponds to our skills, perhaps, but not necessarily strengths? One of the best solutions is actually the task exchange. Task exchange depending on the strengths of another team member. So we've been doing a lot of analysis, just to give some ideas, of different strengths profiles of individual team members to understand where each person would have strengths, competencies or skills or potentials in order to maximize the allocation of the right tasks to the right task strengths, and also in order to maximize the collaboration between team members to be able to openly say that this particular task existing or new task or a new project does not necessarily correspond to their best strengths, and therefore they would not be the most effective person to do that. And that we have actually found really, really effective, even though at the moment there is no yet data to demonstrate that effectiveness. But this is again something to think about, something to consider, is something to consider in accompanying teams if you are working at an organizational level. What is the best strengths for the best project? What is the best strength for the given project, for the given task in this changing and challenging world? So I'm coming to the end of my presentation today. I hope that has given you some ideas, some insight, or hopefully a little bit more of a practical insights of how we can potentially raise resilience, what we can potentially do, what are the main target points, and what are the main strategies to actually raise resilience. So the Spark evidence-based, the existing published studies are here, and obviously the study we just done is going to be published, I hope, soon. And some of the most perhaps most important recent references that we have used to update the Spark Resilience program are presented here. So thank you very much. Thank you very much for listening. And I hope you do have some questions to ask. Thank you.
Thank you very much, Ilona. Thank you also to all participants who are there on YouTube with their questions and their comments. I saw later on there were some questions that were meant for Marta earlier on. They came a little bit later, but there was this one question to you, Ilona, up here, from Dominic in Germany. Hi, Dominic.
Hello, Dominic. Hi, Dominic.
Dear Ilona, what is, from your experience, the most effective, important strategy of all presented?
That's a really difficult question, actually. Yeah. Why it's a difficult question? Because that would very much depend. That would very much depend on what strategies have already been developed, perhaps, and what strategies have been less developed. So that's why the most important strategy would depend on that. I would say perhaps if I really, really had to choose three, because I'm not going to choose one, I'm going to unfortunately be very resistant to choosing one. I would say one of the three most important strategies would be mindfulness, because one of the big differences in our Spark Resilience intervention, now updated Spark Resilience intervention for the COVID condition, was the introduction of mindfulness, not just only as one strategy, but as a strategy that they exercised at the end of each session. So each session of the 8 sessions has finished with 15 minutes mindfulness exercise. And it is a high probability that the effectiveness of the intervention, because we actually had strong impact on all the variables. So it's actually quite possible that the effectiveness of the intervention was very positively affected by mindfulness. So that's one. I would say that the second strategy, very important strategy, would be self-care, that I also mentioned under effective strategies. And here we're talking really simply about the importance of sleep, exercise, and nutrition. So self-care strategies, because again, the literature shows a really, really significant impact of these very simple strategies. And sometimes it's funny as psychologists to say it, because I'm not your mother, you know. So and yet it's exactly what I would still repeat, how important these are. And finally, I would say I would still come back to my favorite perception strategies, is perhaps strategies such as reframing, What is reframing? Reframing is basically being able, so it's one of the cognitive strategies, one of the P strategies. Reframing is being able to look at things from a different perspective. So instead of, I can see this as a door closing, but what door is opening thanks to the door closing? So what are the possible benefits that I can find in this current circumstances, even though there are lots and lots of negatives, but what are the benefits? So that probably would be my third chosen one. So I can't keep down to one.
So there's a lot of thanks, gratitude towards you, and people very interested in the SPARK model. But here there's a question. I would like to know, how did you measure resilience of pre and post interventions?
Yes. What we did, so we used obviously the scientifically validated scales and questionnaires. So for the resilience, we used CD risk. For to answer to other questions which are probably there. For emotions, we used PANAS for positive and negative emotions. For stress, we used perceived stress scale. We used the 9-item work engagement scale and a 4-item meaning scale, but I have to remember which meaning scale, so I will have to look it up. So hopefully that responds. So basically using standard validated scales that were available in the French language.
Yes, and there seems to be, are the results already published?
No, this research is not published yet. However, it's published. No, it's not published yet. However, it's published as an article, as a blog on our website. So it's pre-published in a press release form, but it's not yet published. We're currently working on the actual paper, so it's not yet published as an academic paper. Not yet. Hopefully soon.
But people will be able to get more information on your blog, I guess then.
Exactly. So if you visit positran.eu, you would be able to get more information on the blog about the program and the study, obviously summarized in brief details. Yes.
Yeah. Thank you so much. I think that is now. There has been questions about if the slides will be available, and since people are not registered for this, it's difficult for us. So people will need to contact each one, because what we will have here is the recording, and the recording will be available. That has also been a question about that, and the recording will be available so people can go through the presentations even after we have finished here.
Exactly. And if somebody needs further information, please contact us on the details that I'm sharing right now that are going to be available in the recording. Thank you.
Yeah. So that there you can see the email and further contact information. Thank you so much, Ilona.
Thank you very much.
And yeah, the webpage has already been shared on the YouTube chat. So it's going to be easy for people to find more information about your work. Thank you so much. Very important and very inspiring.
Thank you very much.
Yeah. Marta, are you still with us? Because there were some questions that we missed because it was just after Marta. Are Marta available for questions?
I'm here, yes.
Yes, I think it would be great to have, there were two questions directed to you after your presentations, a lot of gratitude. Do you have any ideas on how to address turnover intention?
This is a huge question.
It's a huge question.
Yeah, it is a huge question. I think, especially in this particular period, it's too early to tell. Yeah. Because one thing for sure would be to work on positive mental health. So that would be, but it's too, the topic is too warm. On the other hand, I must say that turnover intentions in the health system have been going on for quite some time, at least in Italy. And when I actually found it out, I was quite impressed, because we have this stereotype that it's idyllic to be a physician or work for other people, but it's not. So there are a lot of issues at stake, starting from more material matters up to organization and of course mental health. positive mental health and improvement of the working environment. So I would say it's too early to tell. We first have to face the urgencies at the moment.
Yeah. But then the second question was about, is there any plan for longitudinal studies?
Yes. In fact, this was the first wave of a 3-wave study. We are going to run a second wave in 2 weeks' time. So just before, let's say, holidays here in Italy, and then in October again. So we have 3 ways to monitor the situation and to check whether these cross-sectional results can hold on a longitudinal level.
Great, thank you so much.
Thank you.
Then we can turn to the next presenter. We're going from, we've been to Italy and France, and now we're going to Denmark. So Henrik, welcome. He will be talking about constructive journalism, a very important topic, the power of trustworthiness and inspiration. Henrik is an associate professor at Aarhus University and an extraordinary professor at Northwest University in South Africa. And he is, of course, also a former president of the European Network of Positive Psychology. Henrik, now the screen and microphone is yours.
Thank you. Thank you for organizing this, Dora and colleagues, in these difficult times. It's so inspiring to see how people around the world, especially Europe here, of course, are handling this situation. My focus is today on journalism, because news reporting and news journalism, of course, has played a large part in the conception of the COVID handling, and not to a minor degree in a way that they not normally do, because there are so extreme conditions under which it's much more important than normally to get the facts right, you may say, because it's a matter of life and death, and at the same time the rights of liberty and expression and critique and so on may be threatened indirectly by suppressing critique or debate or so on. So it's really an interesting topic to go into, and I will focus especially on trustworthiness and inspiration, because if journalism can be trusted, and if it's inspiring, it's clearly a force for good. It helps people organize, it helps people navigate, it helps people get up in the morning and so on. And if trust is low, public consciousness is confusing for people, and inspiration is typically lacking, because how can you be inspired by something that you don't trust? So I have prepared this talk in 2 parts, looking at the psychological biases related to risk in news reporting, and then looking directly at this new concept of constructive news and how it's been approached during the COVID-19 crisis. First, if we look at how news are reporting to us, perspective clearly matters. And you may say these 2 cover pages are both true, but they send a different message, and they put people in a different mood, and they inspire in different ways. And you may ask yourself if there's any inspiration in the first one, even though it may be true. And you may ask yourself, well, don't people need to know how harsh reality is? And yeah, of course they do, but they're not helped by being disencouraged and hopeless and helpless. If we look at the cognitive biases that are in place here and that are quite well known, there's a whole host of them that I won't go into today, but I will mention a few that are from the political arena very important. For instance, a very well-known confirmation bias, meaning that people favor or seek information that affirm their pre-existing beliefs. This is probably the single most important psychological ingredient in understanding the political polarization that we see. A polarization that very often hinders debate and simply leave people giving up on having meaningful, honest conversations in the public sphere. There are also others, a coverage bias. If things are projected as a horse race in politics, it's really about battling rather than understanding. And if it appeals to emotion, it's very often hijacking people's cognitive capacities so that they make stupid decisions because they're being hijacked. And then there's this concision bias, which is about speaking in talking points and having it all pre-planned, and it's all PR talk, press relation talk, and you communicate in sound bites, as we hear when politicians are asked the same question over and over again, or in different ways even, and they keep repeating the same message. All of this is not exactly healthy, even though it's understandable, and even though it's part of human nature. There are many others, many other biases. I won't go into that, but this group of call themselves Predicted have done a fabulous job in bringing it together. So I can recommend looking at their things as I have done here. A particular cognitive bias that has been at the forefront of debate in journalism for many years now is the negativity bias, which is also at the foundation of positive psychology. Because one thing that really hijacks us, it's not even hijacks, it really characterizes us, is this tendency to give more attention to negativity than positivity, to have a bigger impact and also draw much more attention in the public sphere. And this means that it's understandable why Steven Pinker is saying something like this when he speaks about his recent book, Enlightenment Now. The world has made spectacular progress in every single measure of human well-being. And here's a second shocker. Almost no one knows about it. And here's just an example of something that many people don't believe. It's an illustration of how extreme poverty decreases and decreases, which confirms what the late Hans Rosling has been saying for many years, namely that it's absolutely reasonable to expect that there's a chance that everybody can, on planet Earth, can be pulled out of extreme poverty, maybe even by 2030, as the UN sustainability goal aims at. Here's the same graph illustrated where we have the worst case scenario here and the best case scenario here. And you can see it's very close to eradication of extreme poverty, 2030, if it's the best case scenario. And it's quite likely that we will be able to do something, because another bias that we have cognitively is that we tend to predict the future in linear ways. So we think that the 2020s will amount to about the same change that we saw in the 2010s. And it may well be 100 times more dramatic. And that means that these linear trends may actually suddenly decline or rise, as also the COVID is an example of, even though we don't estimate it because we think linearly. We tend to overlook progress also because it happens so slowly, and because journalism is adopting these principles that I've been speaking about. Almost cliche to talk about the Dunning-Kruger effect now, but it's quite an interesting study still, where if you have people's level of expertise on the x-axis and level of confidences in their own opinions on the y-axis, you can see that it's very easy to be very confident about yourself being right, if only you don't know anything. And then you take a long course and eventually you may acquire expertise and be able to talk with self-confidence again. Sometimes this is called Mount Stupid, and this is called Mount Boring. But when you see debates and headlines and one-liners and sound bites and things going viral on the net and so on, Mount Stupid is much better represented than Mount Boring. And Mount Boring shouldn't really be boring because it's more true. And if you ask yourself, is truth more interesting than lying? Yes, it's more interesting. So this is a deep fundamental problem that we're dealing with here. There's also been, the tone of the news has been mapped for many years here for a period of about 30 years, and you can see that it's getting more and more gloomy as time goes along. And this is a world broadcast new content. You know, it's a world average that's assumed here. So this is negativity in the public sphere. This is for a New York Times. This is the graph I just showed you here, the gray one. New York Times was ahead of the time here, having done this sentiment mapping all the way back to 1945 after the Second World War. And you can see the main trend is actually going downward. The only time where it's becoming a little more optimistic is after they took down Nixon, I guess. So here's a more recent description of what happened to the main news outlets, or some of the main news outlets in the United States. And you can see that it's actually only Fox News that has something of a balance. The rest is highly favorable of negative news content. The red here is by Harvard Kennedy School. And you probably all know this saying, if it bleeds, it leads. It has been a mantra in journalism for a long time. We have to dramatize, we have to sensationalize, we have to give a lot of airtime to things that really go bad to make sure that people get the message. And that leaves people with an exceptionally skewed view of the world often. For instance, regarding violence, here's violence in the United States from 1990 to 2010, according to FBI, less and less violent crime over the years. But if you ask people, which Gallup has done over the same period of time, you know, almost all of them think that there's more crime in the same period. Generally, more than 50% more crime, and some of them think that there's 100% more crime. 100% of people think that there are more crime. And the reason that this is happening is that very often the news reporting when it goes bad, here's a steep incline, here may be a terrorist attack, here's a school shooting and so on, and that makes the headline. And the summary impression that people get is that the world is going to hell, which is not exactly the case. And if they believe that, they'll start acting like that also, and by all likelihood, in some ways, even confirm it through their actions and disposition. After Watergate, these two guys became extremely, Carl Bernstein and Woodward became extremely tone-setting for the news. This was the way to be a good journalist. You know, you take down corrupt politicians. And when Dustin Hoffman and Robert Redford did their portrayal of this and the movement, All the President's Men and so on, that really defined the news and journalistic identity to a high degree. And there's not much positivity in their scheme here. It's about crooks that you can blame, victims you can pity, conflicts you can fight, and dramas you can sensationalize and even distort because it's drama and the truth goes out when the war goes in, and so on. And as a recent initiative to counter this, led by Ulrik Hågerup, who headed the Danish broadcasting system and the news sections for 10 years. And this initiative came to life and tried to understand, can we balance journalism away from this skewed view, not in a way that pulls out the teeth of journalism and makes it uncritical lame and Pollyanna, but just makes it more balanced so that people, even if they see the harshness of the world, the tragedies of the world, maintain an optimistic view of what's going on and remain trustful of the public sphere or the public perception of what's going on because they trust their journalists. Is that possible? And it's this initiative has been called constructive journalism, and it's really supplementing traditional breaking news that we have here, characterized by these things, and investigative journalism, which is going deep and looking in this way, with a more future-oriented perspective, where you also inspire, where you also ask questions about now and how, where you're curious, where you facilitate, where you also look at best practice. But constructive journalism is really standing on the shoulders of these giants also, just not assuming the negative sides of it that I went through before. There are three pillars in constructive journalism as it's currently thought of. And it's this focus on solutions, meaning that not only expose the problems, but also look for positive solutions, cover nuances, strive for the best obtainable version of the truth, which is actually a saying by Carl Bernstein back in the day, and see the world with both eyes open. And that means supplement the negative with the positive, that you get a realistic roadmap to navigate by. And then promote democratic conversation by engaging, facilitating debate, including people in the communities, not excluding them or discouraging them, or even creating what is now called news fatigue, in a way that people actively turn their back on news reporting and thereby democracy. The coronavirus pandemic is a global call for responsible media, we may then say. Good old, thorough, critical, and balanced journalism and more is needed in this situation. And covering COVID-19 constructively, as Constructive Institute is doing, I will briefly comment on. This is too small to read, so I'll just show it. But covering nuances here constructively is about balancing nuance in reporting. Make sure you have the right sources. Don't ask people who are famous for something totally different that they don't know anything about. Considering how much should you report. Don't overwhelm people like I'm doing here. Make sure that the case you use is representative rather than anecdotal, which is, here's something exploding. Okay, that's a good story. But people tend to think that the world is going to hell, and it's maybe completely non-representative. Pick your pictures with caution. There's something called the availability bias also. And if something is very vivid and graphic, we tend to assume much more importance to it than is legitimate. For instance, if we ask people if they think that terrorism is more dangerous than texting while driving, most people will say, yeah, it's very dangerous because they have all these vivid images of towers coming down and people burning and so on. But maybe 100-fold more people are dying from texting while driving. It's just not very dramatic, so nobody sees it. Mind your language. Yeah, but we need to create attention. And if you shout and blame people and ridicule them in public, you'll get a lot of attention, which is true, of course, on the short term. But if you think of your friends shouting at you, how long will they be your friends? And if we think about how it is if a colleague is actually talking down to us, we all realize that it's a matter of very short time before we shut off and stop listening to that person. So that's a fantastic, trivial insight that if you really want a powerful weapon in your communication and really get through with your criticism, you should really speak calmly. That way people are able to take it in. Moreover, if they trust you, it will be very difficult to disregard or dispute even the harshest criticism. Because if somebody criticizes you and you trust them, you'll have to take it in. That's effective. Trust is extremely effective. Also, when we have debate, and that's why there's this good saying that we have to remember in debates that the more you disagree, the nicer you need to talk. Put your reporting into perspective. Yeah. Learn to embrace complexity and base your journalism on facts and be aware that these change day by day. Few examples that Constructive Institute are highlighting is Die Welt, the German newspapers, where they put nuance on COVID through a historical perspective on pandemics over the last 100 years. If we look at promote the second pillar, promoting democratic conversation about involving and engaging people and using different platforms to reach out and find ways to communicate to different target groups and so on. Consider working together with actors, musicians, influencers in order to spread pieces of advice if only they don't speak about something they don't know about, and get people to answer their questions. An example from New York Times is that they activated citizens with experts on online tools where they could ask questions directly to doctors and public officials and other experts to answer many questions by parents and people living under Corona. So this is using social media in constructive ways. And regarding focusing on solution, it's about not only reporting problems, but also solutions. And there are many examples. And if you go to Constructive Institute's webpage, there are links to a number of interesting examples of this from the news outlets that you can see here. Another example, the BBC devoted an entire segment for positive solutions to Corona, gathered a number of stories that show how people are helping each other and finding solutions in response to the coronavirus. We have recently done a survey in Denmark, or I've been involved in one, which has been done by this company, Epidemiologist, under by funding from the Constructive Institute. And the background, and I will read this because it's a very good summary of this, the state right now. The influence of news media is perhaps stronger than ever before. Politicians are bound to communicate through media if they wish to attract the attention of voters. At the same time, it's hard to name a business that has been more severely impacted by the advent of the internet and social media. Traditional news providers are also being challenged by populist leaders who again and again question their objectivity, call it fake news, sometimes, unfortunately, for good reasons. Finally, the outbreak of COVID-19 has had a profound impact on citizens' lives all around the world, including media habits. The aim of the study that we did a few months ago, to understand current media trends with focus on news credibility, perception of news, negativity, and tendency of some to avoid news entirely. And to understand if the constructive news paradigm has potential as a solution to some of the issues raised. We test if there's a demand for constructive news and if reading constructive news content is any different from conventional news. This report can be downloaded from Constructive Institute, a website, for free, and I highly recommend that. And there's also not in that report novel evidence about the corona outbreak's effect on opinion and behavior towards news. Methodology was a survey interview with more than 2,000 Danes conducted in February and March, and a follow-up study with approximately 1,000 Danes in March and April under the COVID-19 crisis. Here are some findings, and these are some of the most important. 15% of Danes periodically avoid news, simply turning their back on it. I don't want to know about it. News credibility in Denmark is lukewarm. Indeed, only 1 out of 4 have what you would say a good amount of trust in news media. I have a graph in a minute. Most Danes would prefer news that focus more on illuminating a case from different sides. They want the nuances. Most people would prefer to read a news article with a constructive rather than a conventional news headline. So if it bleeds, it doesn't necessarily lead. Some people simply don't trust it anymore and turn off, even though it used to work. People it's actually the same mechanism as cry wolf. You know, it works in the beginning, but then it may well be that mechanism that's at stake here. People who read a constructive newspaper article are less inclined to feel uncomfortable. We had this forced A/B test where people read different segments of articles and afterwards report. Sorry, this is my dog. Report what they felt and experienced through that. And then we have an interesting approach. It's rather exploratory, where we use the big 5 to look at who's doing what and reacting in which ways. The trait neuroticists, they really don't like the state of negativity, as some may expect. And then it's interesting that the agreeable and the conscientious one are those who really want to follow news, but are also highly negative about the conflict-orientated negativity. Regarding COVID, it has increased news avoidance, but that's maybe understandable because much of the conflict is not there, at least not in the beginning. But credibility has increased, so this may confirm that not only the health department has a bigger say, but also that there's a kind of reflection in the editorial work going before creating headlines in that situation. Finally, a few graphs. Far too much focus on conflict. Here's an example from the report. News focus on negativity and conflict. Here you can see that 58% agree that there's far too much focus on conflict. Far too much, 58%. And news focus is as much focus on positive as negative in the world. Very few people agree with that. You may say, well, a third or 40% or something, maybe a little more, at least in part disagree or so, but you can see it's overwhelmingly negative perception. People really are aware of the skewed negativity and conflict situation, and it's not good for journalism. Here's a graph regarding the solutions. The question is, do you agree with this statement? News about problems often leaves me with a feeling that I cannot find a solution to the problem. And you can see a lot of people actually feel that way. At least 1/4 here, and you may make the case that if you don't disagree with this, if you're not over here in the last third or so, you're actually conforming. So we may improve methodology here, but it's an attempt. If we look at credibility, you can see here that this is a graph where you can see that not much more than 1 in 4, 26% agree that the media paint a true and fair picture of the world. That's 1 in 4. Imagine being at a workplace where you can trust 1 out of 4 of your colleagues. You know, it's really, even though it's it's not the first credibility survey, but it's the first of its kind. I think it's very important, and you can see from my previous presentation that it can be linked quite directly to positive psychology also, and that positive psychology has a lot to say about this. And to sum up, you may say that this is not about not reporting negative events. It's about reporting both positive and negative events. Much rather, it's about understanding that you can do both in an engaging and a disengaging way, and that nobody is really helped by the disengaging approach in journalism. Apart from a few short-term economic gains or kicks or something, it's much better to be engaged, and you can expect much more consumer, if you would, reliability and trust and loyalty if you prove yourself to be engaging. So and truthfulness and engagement is about, you know, winning the trust of people and inspiring people. And I like to put it this way: perceiving a more truthful and fairer blend of negative and positive news would not only help people make better sense of the world, would significantly strengthen journalism by improved public trust. So this is in no way about holding back good journalism. It's really a necessity for journalism also, in my view. Watchdog role of the press continues to be absolutely essential, but democracy is not helped by a jet black view of the world, making people lose their hope. Final word to Mark Twain: what gets you in trouble is not so much what you know, it's what you know for sure that just ain't so. So with those words, I thank you. Here's a book about constructive journalism and other books that I authored. So thank you for your attention, and I invite questions if we have time.
Thank you so much, Henrik. This was really interesting and so important topic. Media is such a powerful force in our society. There are some questions here. The first from Dominic. He asked, dear Henrik, is constructive news actually decreasing the ratings or the audience rates of news channels?
It is. I didn't have time to go through that, but many newsrooms around the world actually find that if they give people something that they can move on with, that they can run with, that they can act constructively upon, they're more likely to do it. And for obvious reasons, you may say, you know, it's if you have, imagine you're watching football and your team is losing, and that's the news, you know, then what do? Do you walk away energized and full of good hopes compared to if they're winning? You know, and sometimes, and actually sports journalism is the exception from news reporting. They are rather balanced and objective. But sometimes I still hear from news reporters, I get these questions, you know, do you really think it would be interesting to listen to positive news? And my standard response is, how can you say something like that? Imagine watching your football team play ball and you only get to know when the opposition is scoring. Imagine the energy being drawn out of the audience if you don't see your score, your team score and win. Yeah. How can you not see the potential in getting people on board with that force? And this is so.
That's a very good example. I think it's easy to understand. There's another question here for you. Is there from Paula Reed? Is there an appetite for constructive journalism with the big national or international media channels?
There is an appetite, and people are working around the world on this. Again, you can find most of the links and the partners and the funders doing this. It's such a high priority to the UN even, that the UN gave a donation, actually instituted a prize for constructive journalism of the amount of €1 million at the first conference of constructive journalism in 2017. Michael Muller, who's head of the General Directorate in Geneva, is very involved in this. And even the grand old man in peace journalism, Johan Galtung, you can see in a short video clip, he's 90 years old now. He's working with positive psychologists in Portugal, Helena and Luis Miguel and their colleagues. He's working with positive psychology down there. He's being asked by a journalist while he's at a conference in Geneva, do you think constructive journalism is the real word for this? And he says, well, constructive is very important, but I would prefer the word positive, because what's really lacking is a positive side. And he goes on to say, we do need war journalism, of course, but we also need peace journalism. And this is from a Norwegian who actually had a founding influence on journalism by lifting the criteria for negative news, which journalism apparently ran with, while his intention was that they should have seen that they should not only run with that, but that became a one-sided paradigm for 50 years, apparently. You can hear more about it at the second conference on constructive journalism, which is live streamed and recorded on the Constructive Institute webpage.
Thank you for that. We have the last question for you. There's a lot of thanks and gratitude. People expressing very interesting topic. But from Oliver Þórðarson, there's a question: what are, in your opinion, some of the biggest hindrances to the implementation of constructive news for a media outlet?
One is tradition. Tradition has deep roots. And the tradition typically implies a lot of focus on drama and breaking news and immediate, being there on the spot and making money from that. And if you say, well, haven't they wisened up after, recently? Well, many have, but paradoxically, the social media now has a very direct influence on the traditional newsrooms, in that their financing depends on clicks and traffic on the social media also. And because the social media is completely unedited almost, they have to run with that also. So the editorial process and the rigorous checking of facts and sources has been made even more difficult for traditional newsrooms by the social media. So this is really a big one. So we have tradition, which have to be altered, and habits are difficult to change. But we also have this very new phenomenon of social media and Google News and Facebook News and so on, vacuum every news outlet for their news and giving people the headlines for free. And the viral format that forces many journalists to go with the flow earlier than they should, because otherwise they would not be in the news flow alone.
Thank you very much for this, Hans-Henrik. And I think there are some in the comments some consideration about which wording is the best: positive, helpful, constructive. And I think this is something that we are dealing with in positive psychology and in well-being, the science of well-being in general. And I think this conversation will go on. And this topic of course, of journalism was supposed to be very high on the agenda with Ola Rosling and Anna Rosling at both conferences, but we hope they will be with us at either of them, and we will take this further at both the Nordic Public Health Conference as well as the Positive Psychology Conference, because it's a very important topic for a positive society. Thank you so much, Hans-Henrik.
Thank you.
Then we are leaving Denmark and we are going to your neighbor country, Norway. We are going. Our next speaker is Lisa Vivold Straume. She is the academic director of Mind in Norway and a specialist on strengths. And she will be talking about strengths during COVID-19. So, Lisa, are you with us?
Yes, I am.
You are. So now the screen and microphone is yours.
Let me see.
Yes, you have shared the screen with us.
And now you can see the slides?
The slides are coming. Yeah. Yes, it's all here.
Thank you.
Mic is yours.
Okay, well, first of all, Dora and your colleagues, thank you for choosing to run this webinar, despite all the setbacks that you have faced lately with the pandemic. But I also know you put so much work into organizing the conference, so I think it's very good that we at least managed to make it a webinar. Just shortly about my background, I've spent the last sort of 20 years within the interface between research and practice. Did my PhD at the Norwegian University of Science and Technology, working on hedonic eudaimonic happiness and also on strengths. And today in my talk, I will take a general and more practical approach to reflect upon the role of strengths in promoting mental health. I think that is a topic that is always important, but we do know from previous studies after the SARS and the Ebola breakout that pandemics like this may have long-term negative consequences on people's lives. So I do think that we have an extra responsibility to come together and share perspectives on how we can work on this ahead and apply the knowledge. So I will do that through a case. But just first of all, we have all witnessed, and that's particularly interesting with this pandemic, that it's sort of spread all around the world very instantly. So we have all witnessed this sudden change in work and life caused by the corona outbreak. And these are the situational stressors that are imposed on us, like having to work remotely, at the same time taking care of small kids and maybe being teachers for our older kids, working from home with interruptions, but even more dramatic things like restriction of liberty, isolation, less connection with other people and co-workers, which again can lead to goal conflicts. And these are the situational stressors that represent a dramatic increase in the demands we face that may cause stress, right? And we often talk about stress as something that exists outside in the outer world. But the truth is that stress does not exist any other places but within human beings and within individuals, because stress is by definition an emotional and psychological response to the outer world. So psychological stress, such as fear that may cause a rapid heart rate, feeling of lack of control, which again can cause poor sleep and poor concentration and all these difficult feelings that we may have. These are the psychological stressors. And I say this because there's a distinction between a stressor and the actual stress experience. So the stressor can be a person or a place or a situation or a pandemic, whereas the stress is the actual response to one or more combinations of those stressors. And this distinction, I mean, people educated in this area of psychology and related subjects know this very well, but I do very often experience that clients are not aware of this distinction and that they mix together what's outside and what's inside. And when we are working on initiatives for health promotion through the psychological perspective, it is the inner world that we have in focus, which means in this case, we cannot change the fact that Corona turned into a pandemic, but we have a huge potential of working around and adjusting how we help people to deal with it. And learning how to deal with the experience of stress involves becoming more aware of what we feel and why we do feel what we do, and also the different strategies that we use that may either help us to cope with it or actually make it even more negative. And that's the options that, and the different options that we actually may influence. So I think that this is a core component of not only dealing with demands, but also to when we are working on building the resources and strengths that people have and see how we can use them. So first of all, this is the distinction. And then moving on to a few words around mental health and how we understand that. If you look at the picture here, this child has to learn. Someone has to teach her that the feeling she is feeling right here is happiness, and that feeling probably is experienced someplace inside the chest. And also she has to learn that the interaction with her mother, if that's her mother, was the cause of that feeling. And afterwards, when she falls off the swing, she will probably feel fear. And that's a feeling that is located in the stomach. And it's not the same as hunger, even though it may feel similar for someone. So that distinction is important to become aware of as we grow up. And a little bit later again, when her friends leaves her out of the play, she will feel sad and rejected. And she has to learn that she still has value as a human being. And it is our responsibility to make sure that all the grown-ups she meets on her way, her parents, her teachers, her coaches, her future leaders, have the knowledge and insight and understanding of what mental health is and how to promote it so that they can guide her on her travel through life. And this brings me to an interesting perspective or maybe definition of mental health. I mean, there are many different definitions out there, but I particularly prefer this one, which very often our own Norwegian professor, public health guru often uses. And he says, Arne Holte, that mental health is our ability to observe and understand our feelings, to think reasonable, to regulate behavior, and to keep good relations to other people. So it maybe differs a little bit from other definitions, but I think this one captures the very core of where we can really invest in training and developing and research and even more training again, so that we make sure people grow and are able to cope with the demands that comes along. And I agree with the perspective also that this is the most important resource in the world, because if we do not utilize this resource, we cannot utilize the other resources. So moving over more to the mental illness perspective, because we know that very often in everyday language, when we use the word mental health, people think mental illness, but I have pinpointed so far that these are two different things. So mental illnesses is usually defined by the diagnosis that we can put on people that struggle and do not function good in their lives. And just some interesting numbers from the latest report from the Directorate of Health in Norway. They estimated that the costs of mental illnesses only in Norway, and remember that Norway is the country scoring among the highest in the world in terms of happiness ratings. And the latest calculations they did was that the cost of mental illnesses in Norway is 25 billion euros each year. And that's an insanely huge amount of money. And just to give you a perspective of it, we are now in Norway developing a new oil field, which is called the Johan Castberg. And the estimation of the amount of money we will earn from that one for the next 30 years is the same amount as we spend each, or what mental illnesses cost us each year. So that's a very interesting thing to think about, the differences and how much that actually is. But the reason why we find this, or we know that the costs are so high, is that depression and anxiety, as the two most prevalent mental disorders, are also the most expensive because they start very early. They cause great disability. They have very modest treatment effects and very high risk of recurrence and also early death. So we know that for these kinds of mental illnesses, half of the people who experience them starts very early in the middle of teenage. and 3/3 starts in the mid-20s. So it has a very early debut, which again influences education, influences choice of work, and influences income. And that explains why the costs are so high. But most importantly, we cannot treat ourselves out of this, because we have seen for the latest 30 years a huge increase in treatment availability, both in psychological therapy, but also in drug treatment. And we do not see a reduction in prevalence of mental illness, right? So there is still increasing number of mental illnesses, even though there is an increase also in treatment availability. And that brings me back to the mental health perspective, which is that the only way out of this is health promotion. Of course, we are still going to treat illnesses and invest in making sure that people do not develop mental illness, but promotion as a different perspective is where we can actually gain the most positive outcomes of it. And there are a number of things that we can do to increase our coping ability and raise our resilience levels. And I've just summed it up in 3 words here: awareness, exploring, and applying. And first of all, awareness means that I think we have to put much more effort also in early years, but also with grown-ups, in training people and teaching people how to understand the underlying mechanisms of our thinking and our feelings. And that is why I showed you the picture of this little girl. She has to learn that what she felt at that moment was happiness. And just by naming emotions, we can create a better understanding of them. And also when there are negative emotions, create a bigger distance to them, which and again enable us to think more wisely and then to regulate our actions. So the awareness part is a very important place to start before we start exploring how and why we react the way we do. Why do I have the feelings I have? And what can I change and what can I not change? What is inside and what is outside? And then after becoming more aware and through this exploration, we can start applying. And of course, this also applies to the strengths and resources that we have. But strengths and resources are very closely tied to feelings, which is why, and feelings maybe have a higher voice. So when you experience them, they yell higher to you than the strengths might do. And the bottom line here is that we cannot change what we do not notice. So the first step is becoming more aware of what we're feeling at any given moment. And that means cultivating the capacity to observe our emotions rather than being run by them. And simply naming our feelings, as I said, gives us more distance to them, especially when they are intensely negative. So to sum up my point of view here through a metaphor with the iceberg, I'm sure you've heard it before and seen it before. But it very clearly distinguishes between these different steps and perspectives that I have put words on so far. So the top of the iceberg is what we can observe. Outer factors, the situations and the things that happen, the situational stressors, but also the behavior that is very visible to us. But then underneath, you have all the reactions and thoughts and feelings, and these are fluctuating. They are not constant, they are not stable. So they change quite fast and can, have a huge difference to how they are experienced. And as I have said so far, we have to turn inwards and cultivate our skill in observing what emotions and feelings that we have and why we have them. And that is not enough, although it's a first step, because underneath there again, we find the more stable perspectives or the more stable characteristics of who you are as a person. So the behavior and the reactions does not define you as a human being. It just explains what your experiences, but deeper down in the iceberg, you find the more stable things that define who you are as a person. The personality traits, yes, but also your core values, which we know are really, really strong drivers for behavior, and they are inseparably tied to feelings. And I will explain a little bit more on that through a case that I think this one sort of can sum up how we can work on this practically through either therapy, but also leadership development, which this is the case is based on. So what you see here is the personal strength map of a CEO in the Norwegian company named Enova. His name is Nils Christian Nakstad, and he knows that I'm sharing this with you today. So this is a sort of a true story. Enova is a company in Norway owned by the Ministries of Climate and Environment, and they provide state aid funding of, I think they're up in 1.4 billion euros now. So they conduct soft funding projects on new technologies to reduce greenhouse gas emissions and invest in climate technology. That's their mission. I have been his personal trainer in leadership for a few years now. And we have actually trained all leaders in Enova in hands-on tools for spotting and applying values and strengths in how they lead. And also placed a lot of focus on building this learning-oriented culture with high group psychological safety, where people actually dare to take relational risks and dare to share perspectives and challenge each other. The map you see here was created in a semi-structured interview where I asked questions that invited him to tell stories about what he had been doing and how he reacted to different situations and how he chose to respond to them. Again, I am exploring the more inner values and drivers for his behavior. And my goal in inviting him to tell stories is to get enough information that I can ask follow-up questions and then invite him over to more awareness, to be aware of the mechanisms that have played around in his choices. When we spoke, it became quite clear to me that his focus was very strongly up in the right corner. He was very into result orientation, performance. He was goal oriented and very, very valued hard work. And I had, picked up these things and put them down on the map. And just to make a note on that part, there are different standardized measures you can do and tests that you can do on strengths, which gives you your profile. And I think they're good. They give awareness, and it's possible to use them also to explore and apply. But the reason why we still sort of stick to this old-fashioned Carl Rogers active listening approach is because the relation that we create in this kind of dialogue is very, very strong and very beneficial for the coaching process that comes afterwards. Well, back to his strength map. It was clear to me that these were core strengths and values that he had, and I was sort of ready to move further on and fill out the map, asking questions and interpreting his answers and follow-up questions to bring him to this awareness mode. But he kept coming back to this part. So I had to be a little bit creative in the kind of questions that I asked. And then I said, well, I'm just very curious, why did you take the position as a CEO in Enova in the first place? I mean, looking at your CV, I would take a guess that you can pick pretty much any job, top job offers there in Norway at least. And that was the question that made him pause, that made him wait a little bit before he continued speaking. His voice got lowered, the tempo got lowered. So there was a shift going on in how he responded to my question. It made him think. And as a meta reflection, that is when I thought, okay, now we are closer to that magic moment when people move from the teller mode, they just tell stories and explain, to the more awareness mode where we start to see different perspectives and understand why and how. And the answer he gave me was that I just came to my mind the day I got that phone call from the people who wanted to offer me that job. I remember I was in my car and I had to just stop to give it a little bit of moment to think. And he explained that he had this very, very strong dream, a mental picture about his grandchildren, the grandchildren that he still don't have, but that he always dreamt for and that he hoped he will have in the future. But again, he said he had this mental image of him taking his grandchildren on his lap and look them in their eyes and say, we did everything we could. I promise you, we did everything we could to hand over a sustainable world to you that we almost destroyed. And when he started talking about this, I saw how much this meant to him. I saw that there was a very strong vision behind his position as a CEO in Innova. And he combined that vision with a very, very strong sense of resilience and also knowledge that we have the money to do it and we have the technology from the oil business that we just have to transfer over to purer forms of energy. And it is possible if we invest time and effort and energy and if we do it as a one team. So two important questions is addressed in this story. First of all, as to the grandchildren, that is what I had to ask him. How are you going to manage to do that with the speed and intensity that takes the breath away from almost top athletes? I mean, wouldn't it not require that you sit down, think slowly, involve your team, and discuss how to solve such a big task? That's not something that you only can solve by being hardworking and result-oriented and have tempo and efficiency in what you do. And that was, again, one of my a bit challenging but very important follow-up questions that made him pause again and made him have to think again before he started to explore and explain more around the kind of core values that were at play in this vision and in this perspective and in the actual reason why he took this job. So now he started to mention words like being present, and we're talking about a mental presence, not a physical necessarily, about wisdom, about being visionary, about having depth. And he also really valued complexity and being authentic. And all these words are not opposites of the others, they are complementary. But when you focus a lot on performance, efficiency, and hard work, and you want to have tempo in what you do, it's difficult at the same time to sit down and think in depth and think about the complexity and involve your team and take your time to create that future visionary picture of where you're heading. So the whole story here also exemplifies that magic moment of creating awareness through exploring, of understanding how these intense and fast-paced values was overused, and the most central values for the dream was sort of resting on his map. They were values that were important to him, but he had not played them up as strengths. And that's a difficult but right decision that had to be made in the near future, was that it would require more wisdom, more presence, more authenticity, and more collectively working with his team to make sure that he was not, heading away from anyone here. And that sort of kicked off his change travel from being intense and impatient and result-oriented to the lower left corner with honesty, respect, and learning orientation as his personal leadership development project. So again, creating this strength map and this value map is a practical method where what you gain is both the insight and the awareness and exploring, and it gives you a foundation for working and developing further, but it also creates a very strong relation between the coach and the person who is being coached, in a way that gives you the mandate to really challenge and ask the difficult questions. Because this is not necessarily a comfortable process, but it's a very interesting one, and it's a very eudaimonic one in terms of learning and developing. So his personal project as a leader in his leadership development program was to focus more on wisdom, depth, and presence. And as a perspective, this corresponds to Hans Henrik's presentation on constructive journalism, that you focus more on what you want more of. It also corresponds to Ilona's talk on resilience and focus on the different strategies that actually will bring you future towards the goals that you have, instead of only focusing on what you should not do and the consequences of that. And just to make a short note on this, we have been working in this company as in many other companies, and we are also collecting data on some of the biggest project that we're running now that we'll hopefully have ready for the next conference in Iceland to present. But all the leaders have gained their personal value strength map. They are trained in how to spot strengths in their employees. We have worked systematically on connecting those values, the personal values, to the organizational values, to make sure that there are no value conflicts at play, and to make sure that we can align the company values to the personal values, because if they're not aligned, it's going to be hard to live up to them. We have also spent many hours discussing, okay, what's the potential overuse of organizational values? What's the consequences of being too daring? Because the story of this CEO was the consequences of being too focused on efficiency and hard work and results. But I would not ask him to do less of that. I just wanted him to be aware what to play up so that it could balance our potential overuse. But it's just important to discuss in a company setting, okay, what's the consequences of being too thorough or too daring, and is it possible to be both at the same time? And this is important because values are really, really strong drivers for how we feel and how we act. And even though there are many other psychological mechanisms at play when we try to explain reactions and behavior, values and strengths, I would argue, is the most efficient approach to work practically on. So let me just move further to, I can also just make a short note on how we have developed now train-the-trainer programs that we are implemented in UNHCR for how they are working on ethical decision-making and training good ethical decision-making, but also the African Development Bank. We are running programs for train-the-trainers and to train them in how to work value-based, strength-based, and connect that with the organizational values, the vision and the strategies of what they're realizing, and also how and connecting that with the code of conduct. Just to sum up a little bit about the theoretical background here, because as I said, and I'm sure you all know very well of different standardized measures and also the different approaches within positive psychology on working strength-based, because you have some programs focusing quite a lot on talents and some are focusing more on capacities, and you have the values in action approach, which is the one that we sort of apply practically when we work on this. And to sum up, theoretically, what's underlying the story about, or the case with the CEO in Innova, is that values are stable and general life rules, which means that we can go into a meeting and we can change our meaning when we get new information about something, but we do not change our values. And they are stable in terms of going across domains, which means that if I have quality as an important value for me in work, it's not that I'm going to stop being concerned about quality when I get home. Or, for instance, honesty. If I value honesty, it's very likely that I will play that out as a strength in the different situations that I'm in. And if I come home from work and I stop being honest, it's not because I changed my value. That's just because I act against it. And that's going to cause me a lot of stress, but that's a different story. So values are something evaluating, something desirable, something that we want to do. And that is often when we ask people, what are values to you? They very often refer to metaphors like captain of the ship, it's the inner compass, something that guides us in our choices. It explains our preferences, and it also very often can explain our actions. Why did I stick to that challenge? Why did I not give up? Because that was so important to me. We also use values to belong, to be part of a group, to build our identity and to find meaning in things. And they are, as I said initially, inseparably tied to feelings. So again, back to this approach and way of working, especially when it comes to health promotion and building resilience and building strong and good strategies for coping with demands. I mean, the generation growing up now, they have never seen a peaceful world in this terms of no crisis going on. We have the climate crisis, we have terror attacks, we have refugee crisis, we have pandemics. So there are crises all over, and we will continue to face demands. And I think in that picture, because the world is so complex and not linear, I think we need to build a deeper and stronger understanding of how we relate to ourselves, to the world, and to other people. And as I said, values and strengths are a very practically and very, very efficient approach of doing that. And I have used the words values and strengths interactively now. I've used them for the same things, but just to make that clear, values expressed in a pattern of thought, feelings, and actions are what we define as strengths here. And that is why I said that on the strength map I showed you, there were some resting values, values that are core, important, guiding in your life, but that you haven't played up as strengths. Whereas he also had some strengths and values that were maybe overused. So it's about balancing that part. And I see that time is running out, and I started my presentation with a few perspectives around the differences between mental health and mental illness, and what the situation in Norway, which is a country that scores very high already in happiness scores. And I do think that we are moving into a future where we will probably see some lasting negative effects on mental health and mental illness due to this pandemic. We don't know yet, but we do have some previous data that can give us some hints about it. And nevertheless, I do think still that positive psychology and working value-based and strength-based is an approach that can help us move from this sense of urgency to a sense of energy, because that is what we need in order to build even stronger societies and better coping strategies, so that we are ready to face the next wave or whatever comes our way. So thank you for your attention. That was what I had for you today.
Thank you, Lisa. Thank you very much. There was one question that came along, but that was if you had developed the tools yourself. And I've already answered that you with your Mind team has developed these tools, and I have put the Mind website on the YouTube chat. Is there anything? Yeah, we are a little bit behind now time. So, but is there something that you will add to that? The development of the tools.
Yes, it's that we are soon finishing the train-the-trainer concept that we are applying in the African Development Bank and in UNHCR is something that we will launch during fall, also for others to participate in. And even though I did not present any of the research now, it will be a part of the training. So yeah, you can just follow up on that and see our webpage, mind.no.
Yeah. Thank you very much.
Thank you.
So I will be introducing myself for the next presentation. For those who don't know, I am the director of the Division of Public Health here at the Directorate of Health in Iceland. And I'm also the director of the Positive Psychology Program and the current president of the European Network for Positive Psychology. And what I would like to share with you are results of our study or here at the Directorate of Health and Wellbeing measures before and after the peak of COVID-19 here in Iceland. The question that we've been asking ourselves is, what impact did COVID-19 have on health and well-being in Iceland? And there is not a one simple answer to that. What I'm going to present here is the changes in health and well-being measures among adults and the adults in the normal population before and after the peak of COVID-19. And there are some other things that when we look at special groups that have different results than the normal population. So it's important to keep that in mind. There are studies here in Iceland about families with children with ADHD who are feeling worse, and there are also some signs of people that have been struggling before that they are worse off. But what I'm going to present here is how the results of the monitoring of health and well-being here at the Directorate of Health. And my team here at the Directorate also took together some 10 good advices in times of COVID-19 that we shared on the national television and social media with Icelanders. So I'm going to share those good advice with you. It's not only for the COVID times, but it's just based on what the research has shown us that are important for our health and well-being. So this is one of my favorite figures. It's almost in all my presentation, but we've been reminded of how important it is to look at all the 5 steps of healthcare. How important it is, of course, when we feel how the whole society, when we are facing a threat, of course, we put all our efforts into saving those who are in danger. And that has been amazing to see how the society here in Iceland and around the world have been willing to make some changes to protect the elderly and the vulnerable. And we also are aware of how important it is to not just wait until we deal with those who are facing or already sick and are facing the disease or even death, and how important it is for the protective and preventive methods. And during the last decades, we have been shifting the model for communicable diseases to non-communicable diseases. But now, in many of Western countries, we were all almost out of the threat of communicable diseases, but then we again have something like COVID-19 coming, which is a big threat, and reminds us of those important steps and about the preventive methods and the health education, how important it is to wash our hands and with the physical distance, and then the promotional step is about how can we create an environment that's healthy and help us to choose healthy choices to increase the quality of our life and our well-being, not just keeping us alive longer, but adding some life to the years that we're living. But this is not often as clear when it comes to these non-communicable diseases like heart diseases and mental disorders, when it's not as clear when you are sick and not sick, and the cure is not as clear often as with the communicable diseases, but it's still important to keep in mind and use the same methods or interpret these methods for mental well-being, for example. So what I'm going to present here, I mean, we need to know more about health and well-being. And what we have been doing here for several years is to monitor the health and well-being of the population. So we know how different situations, how they will impact the health and well-being of the nation. And you can see this from these are information from covid.is. You can go there, it's all in English as well. The data, we can see the day today, how they're changing, and it's quite clear that it started as Þórófur mentioned earlier this morning. We started having the first incidents of COVID in end of February, and it's mainly March and April that are our COVID months when we've been dealing with, and then the peak was in the beginning of April, and we have hardly had any cases since the beginning of May. So we are looking at March and April especially. How was there any changes in health and well-being of Icelanders at that moment? As I say, we are here at the Directorate monitoring this. We have, in collaboration with Gallup here in Iceland, we have around 500 answers per month from people 18 years and older. It's a quota sample representing the whole population. There are topics there like physical health, mental health, happiness, loneliness, stress, and some health behavior questions about nutrition, physical activity, tobacco use, alcohol use, but I will be mainly focusing on physical, mental health, happiness, loneliness, stress, and sleep. So I'm going to present for you first the results on physical health, mental health, and happiness. And there is this question that's used in many studies around the world. How do you evaluate your physical health in general? And there are 4 categories, answering categories. It can be very good, reasonable, or bad. And as you can see, this is from 2017, we have been monitoring monthly since mid of 2016. We have whole years from 2017, 18, 19, and the first 5 months of 2020. There wasn't any big changes here, and here we have the months, and I decided to show you the whole thing, even though it's a lot of numbers, just to show you that there are some changes. If we look at each month, each bar represents each month. So the last that you see is May 2020, and the first one that you see is January 2017. And what we've been looking at is March and April any different than January and February and May 2020, but also looking at is March and April in 2020 any different from March and April 2019, 18, or 17. And as you can see here, that there is increase in people describing their health as good or very good during March and April. Especially March, we have a very high 6.3 mean, and all those means are changed into a scale 1 to 10. So, and with that 10 as being the highest. So, for example, in March 2019, the mean was 5.4 compared to 6.3 in 2020. And you see also it's high, but it's going a little bit down in May, but it's not significant. There was a significant increase in people reporting that their physical health was good in general. And we did, if we look at other statistics that we do have, that there was less cases of influenza. People were taking more care of themselves. They were washing and made more cautious because of COVID. So they were also less exposed to other infections. We have the same question for mental health, and we've had that for a longer period, but there seems to be a little decline from 2020 to 2019, but we also have this by month.
And there, when we look at the months, then we see an increase in March and April. There are higher prevalence of people expressing very good or good mental health. But a little bit shocking thing is to see that this goes down in May, when the peak was off and we had almost non-COVID-19 cases, and life was more back to normal, then less people reported good or very good mental health. Then we come to the happiness, which is the concept that has some roots in the word hap in Icelandic, meaning luck or chance. But we know that happiness is not about luck or chance, it's something else. But we have been measuring happiness for a long time, and with this question, taking all things together, how happy would you say you are? Where unhappy is 1 and very happy is 10. There are not that much of a difference between the years, but when we look at the months, we see more differences. And there was also in April the highest mean of happiness in Iceland reported, and it's going down again in May. So when we take this together, Icelanders evaluated both the physical and mental health better during COVID-19, and the mean happiness score in April 2020 was higher than the months before, was higher than in April the years before, and mental health and happiness went down again in May. So let's look at loneliness and stress. We know that from studies that the most important factor for happiness and mental well-being is social relations. So also we know that loneliness is a negative impact because this lack of social connectedness. And we also know that stress can be a threat as well. So what's happening here? Not huge changes on how people respond to this question. If we look at the mean for the year as a whole, how often do we experience loneliness? On the scale, never, seldom, sometimes, often, very often. And then, between these, not that much of a change. But when we look at the months, there are bigger changes. There's a significant increase in people experience less loneliness during the COVID-19 peak months, March and April. So this is on a scale, turned to a scale 1 to 10, when 10 is for those who are never or seldom. There's nobody who's never lonely, which is maybe fine. It can be okay to be lonely seldom. But if we look at the others, they very often, sometimes, seldom, that this is different, and there are less people who feel often or very often lonely compared to the months before and after, or the months, years before. And the mean score is significant higher in March and April, and significant lower in May. And how often does this apply to you? I experience a lot of stress in my daily life. And this is the same. The higher the score, the less stress. So always that the highest number is the best for your well-being. So there's a significant increase in this scale with a significant decrease in stress. So people are less stressed. And when we look at this also, the months, and I see here is a question about the significance. I mentioned it once, and if you look at the graphs, if there is a plus or minus behind the numbers, then that means that there's a significant differences. So we see here's again, from March to April, there's a significant differences in decreased stress among adults in Iceland. And this is going
down again in May. So there are some changes. Our conclusion on these results are less people felt lonely and stressed in March and April, but the prevalence of loneliness and stress increased again in May. Let's look at sleep. Sleep is one of the most important factors also for our well-being. And it's important to get adequate sleep. How many hours do you normally sleep at night? And here the number is just the higher the number, the more hours you sleep. So the recommendation is for adults to sleep 7 hours, at least 7 hours per night. And that is so the light blue goes up to that, and the two darker blue are those who sleep 6 hours or less than 6 hours. So again, if we look at, there are some differences between the years, but not years, but the difference is a little bit more during if we look at the months. And we see in April, we have the highest prevalence of people getting adequate sleep, over 80%, and it goes down to 75% in May. We have been looking at, of course, that we could, why is that? A lot of people were working from home, they were less commuting, so they were able to sleep a little bit longer, didn't have to didn't need the time to drive or commute to work. I mean, there's a lot of things, and there was a less, of course, activities going on, so that might explain the stress. And the loneliness, people were really, because as we in the chat here, we did focus a lot of it. It's about physical distancing, not social distancing. People were encouraged to be in touch with their loved ones, and we're using Zoom and other, calling much more the relatives. So, and there were also here in Iceland, there were some actions towards those who lived alone, and there were nurses, they were calling people who lived alone, something that is not a normal routine, but trying, the whole society trying to take care of those who were vulnerable and lonely, and that might be, but I mean, these are all speculations. As I said, the highest prevalence of enough sleep was reported in April, 81%, and went down again to 75% in May, when the life was more back to normal and people were commuting to work and school, etc. So the conclusions are that improvements in health and well-being among adults were detected during COVID-19 peak in Iceland in March and April. These improvements seem to be declining again now in May. And what we've been looking at and discussing is how was life different during COVID-19? And is there something that we can take? Is there something that we can learn from COVID-19? If it was better for the majority of people, better for the sleep, less stress, is it then something that we can learn? We have information about the physical activity. There were more people that were physical active 30 minutes or more per day. People who are smoking less, using less e-cigarettes. And so there seemed to be a lot of changes, and people who were willing to make some healthier choices, or were they willing or were they forced? That is also an interesting question. And it seems to be that it's not something that we are maintaining, but we are changing back to normal. And do we want to go back to normal? It seems to be already there here in Iceland. So for those who are not there yet, it's a very important question. How can we create a society that impacts our choices in a positive or a constructive way? I think it's very important to monitor health and well-being like we're doing here, and to be able to understand how different things in the society impact our choices and how we live our lives. I want to share with you one of my favorite quotes that has inspired me also in finding ways, how can we create a society that helps people to live a fulfilling and meaningful life. I don't know if it was him that said it originally, but at least when this has been reported, that when Dalai Lama was asked what surprised him most about humanity, he said, man, because he sacrifices his health in order to make money, then he sacrifices money to recuperate his health, and then he's so anxious about the future that he does not enjoy the present, result being that he does not live in the present or the future. He lives as he is never going to die, then he dies having never really lived. And when I read this really was in line with my search for how do we help people to live their life to the fullest and enjoying it. And I think also what's very true, it's to be in the moment, not being in the past or being in the future, but being in the moment. And maybe we were a little bit forced to be in the moment during these COVID times. That's one speculation. And since I think I still do have some time, I want to share with you the 10 good advices that me and my team created and sent out to our fellow Icelanders in order to increase the mental well-being. That is the goal, both in positive psychology and public health. This is a curve that we want to shift. We want to shift the curve to the right. And it's important also, as this is a curve and an image from my mentor Felicia Hubbard, and she also has in her email now, remember that kindness is also contagious. There are some things that are contagious, that are good, and we want to spread around, and that is important. But here are the 10 good advice in times of coronavirus. I'm gonna go through each one of them. The first one is take good care of yourself and your loved ones. Look after yourself and find constructive ways to meet the challenges we are facing. Spend quality time with your loved ones. Play cards or board games. Go for a walk. Play outside. Do something creative. Read and laugh together. Create good memories. And then the second is about gratitude. Be grateful for what you have. Pay attention to the good things in your life and be grateful for them. Think of 3 good things to be thankful for every day. For example, at the dinner table or before going to sleep. Our thoughts have an impact on how we feel. Third one was about nutrition. Eat healthy and good food every day. It is important to have a healthy and varied diet. Choose foods that are naturally rich in nutrition, such as fruit, vegetable, whole grain produce, and fish. And remember to take vitamin D, especially in Iceland. Eating regular meals and enjoying your food is the best way. The next one is about physical activity. Physical activity is important for your mental and physical well-being, improved sleep and increased energy. Engage in brisk physical activity daily. Adults for at least 30 minutes and children for at least 60 minutes. It is better to do a little than nothing and to limit prolonged sedentary behavior. Promote better sleep with good sleep habits. Good sleep is essential for coping with daily challenges. Sleep has a positive effect on the immune system, concentration, learning abilities, and is essential for children's growth and development. Establish good sleep habits to get adequate sleep based on age. Avoid using alcohol or tobacco as a coping strategy. It is not helpful to use alcohol or tobacco to cope with difficult feelings, such as worries and anxiety, or in order to relax. Alcohol consumption and smoking weaken the immune system, besides adversely affecting health and well-being over the long term. And we did monitor a less heavy drinking during COVID. Less drinks while people were drinking. Be socially responsible and follow instructions. Show responsible behavior and follow instructions from the civil protection authorities to protect the people around you as well as the healthcare system. At the same time, avoid unnecessary worries as they can adversely impact quality of life and our sense of safety. Continue learning and get things done. Spot the opportunities in these unique circumstances. If you have some spare times, we also realize that people, some had more than enough, but if people had some spare time and were looking for something to do, then we encourage them to learn something new or consider the things on your to-do list that you have not been able to complete. Now is the time to learn a new language, prepare a new dish, read the book, waiting on your nightstand, sort the family photos, or tidy up the storage room, as I said, if you need some tasks. Give to others, show kindness and compassion, do something kind for others, practice compassion, smile, give time to others by making phone calls, showing interest and expressing gratitude for friendships or favors. Volunteer if you can. Seeing yourself as a part of broader context provides fulfillment and strengthens your relationships with others. And the last, enjoy the present moment, here and now. With fewer social gatherings, we're given the opportunity to slow down, take advantage of the circumstances, and learn to enjoy the moment and dwell more in the here and now. Notice the beauty and the small things around you and in nature with all your senses. Let this time be nourishing and rewarding. So these were the messages that we sent out. Maybe people did follow them in March and April, but the challenge is, how can we keep following these advices and live our life like here and now, enjoying the moment? Thanks. I hope to see you in Iceland at the Nordic Conference in August 2021, or the European Conference of Positive Psychology in 2022. More information on the website. And here is my email. Thank you very much. I will now look to see if there are any questions. Yeah, I can see. Maybe I need to, I see here from Dominic, are these studies done via questionnaire? And they are questionnaire. And we have been combining them with hard data here as possible. And this is just a preliminary first results, and we will do that. We have been in contact also with primary health care, and they did not see any increase in mental disorder or mental, but those who were not feeling well before, they were feeling worse during, a small minority. And also people with families with children with special needs, they were worse off. So it's not like COVID-19 was great for everyone. It seems to be affecting people very differently. And I think that's very important to take into account, that even these are like means for a sample of that representing 18 to 80 years old or 80 plus. But we were surprised to see this a little bit, but I also did study the impacts of the economy crisis here in Iceland, and we saw some increase, especially well-being among adolescents. And these positive benefits are also going back. So it seems to be also that when we are facing challenges and really reminded of what is most important, that we are more able to live a good life than when the economy is going well and not facing any big challenges like this. I maybe need to go through these. Now, there's quite a lot I know to see what is a question and what is a comment. Sorry, I'm here looking at the. Yeah, there are also some just answered about the statistical significance. And these are representative of the general population. It is. There aren't any infographic facts of this, not yet. It's just preliminary results that we will work with. I think that is it. If you have a question, please write it again. I've been through it and I can't see any questions that I have not answered yet. But thank you so much for being here, and Julia, thank you for the interest. It's really great to be able to be in contact with you, even though we could not meet here. But I've been planning this conference, post-psychology conference, for 15 years. 2 more years I can do that. Just looking forward to see you there, or if you and if you also want to come next year, there will be an interesting topics at the Nordic Conference of Public Health as well. I think we're now moving to the United States. See if our friend Ivtzan has waken up in the middle of the night.
The United States is ready for his presentation. Hi, Dora.
See you. Good morning.
Great to see you.
Good night or whatever.
Yeah. So hello, everyone. I just woke up at 5:30 a.m. here in the US.
But we've been through the topics and now of how can we create a meaningful, mindful life past COVID. It seems to in Iceland we managed better during COVID, but we are getting worse after. So we will listen very carefully. The microphone is yours.
Thank you, Dora. And you know, it's very interesting that while you were speaking, I was contemplating how in many ways we're in very different places. I think Europe and the US, while Europe is coming out of the pandemic and looking forward and trying to see how to rebuild, I feel that we are now drowning under the impact, and it doesn't feel as if there's a real light at the end of this tunnel, at least at this point. I'm sure it will happen at some point, but right now things do not feel as if they're moving in the right direction, sadly. But before I jump in, I just wanted to say, because you were speaking about the conference, and I just wanted to say, for the sake of those who are kind of joining us today, that as Dora said, she's been working on this conference for long years, and she's been doing an incredible job. And I know that if we were now in Iceland in the conference, we would have had an incredible experience, and that's due to your hard work, Dora. So I wanted to thank you for that, and we will be there in 2022. Yeah. Okay. So welcome everyone. It's great to be here with you. My name is Itai. If you don't know me, Ivtzan, I'm what am I? Those interesting, ever-shifting labels. I'm a university professor at Naropa University, which is probably the only university around the globe where mindfulness, spirituality in general, but mindfulness more specifically, is integrated into the entire curriculum. So everything we do, everything we teach is mindfulness based. Every course, every session, everything we do, which is a very, very interesting approach. I'm part of what's called the mindfulness-based transpersonal counseling. So I teach future counseling psychologists how to integrate the transpersonal and more specifically mindfulness into their work with clients, which is, I believe, a very powerful process. Spirituality is kind of deeply rooted within me personally and within my work. And I know that at least some of you are part of the group that Ryan Nimick and I have created on spirituality and meaning, where we explore the role of spirituality in science. I'm also the director of the School of Positive Transformation, where we offer a lot of self-inquiry, positive psychology, and mindfulness-oriented courses. And I think that in general, if I had to kind of pinpoint, and this is very relevant to my talk today, if I had to pinpoint what is it that drives me, I would say that it's this experience of digging deeper into ourselves to find answers as to what's right for us. At the heart of pretty much everything that I do is that powerful motivation, because I feel that this is the way to live life, and for that reason, mindfulness and meaning are so central in my work. I've published books, I've published research. I've done a lot of teaching around those topics because I passionately believe that they are essential tools within our toolbox as human beings. Doesn't matter who you are, what's your background, where you're heading in life. It's the basic toolbox of being human and living life fully that requires us to play with mindfulness and questions of meaning and purpose in order to live life fully. And I think that today under COVID-19, this becomes even more prominent. So today's topic for the presentation is that combination of mindfulness and meaning being linked to the current challenge of COVID-19, which we experience all over the world. So I'll start with a little bit of discussion over the pandemic and its impact, because I feel that it's a background that we need in order to move into the questioning around mindfulness and meaning. God bless whoever found and manufactured coffee. So there's a new study, quite a prominent study in today's understanding of the pandemic. It was published in the journal Science by researchers from Harvard School of Public Health, and it's modeling the spread of COVID-19 in the US. And one of the conclusions, it had a widespread impact, is they say, and I quote, "Prolonged social distancing may be necessary into 2022. Into 2022, we're in the middle of 2020. Now, it goes without saying, no one really knows exactly how long social distancing would remain in force. But we do know one thing for sure. The world we knew in 2019 is not the world we experience in 2020, and probably not the world we're heading into in 2021 and beyond. So we are now facing a new way of living life, and many questions that accompany those new ways of living life. And those changes, which we first thought of as temporary, they become, some of them, not all of them, but some of them become more solid and more permanent-ish, and with every passing month. And that requires our own adjustment to whatever is happening. So a few obvious examples. Healthcare is going through tremendous changes, highlighting telemedicine, a lot of online medical services. In education, wow, education, it's just crazy. I don't know if you're involved in a university, but many universities around the US, including mine, were closed for any on-campus face-to-face teaching for the last 4 months. And we've just been told that we are not going back to teaching face-to-face after the summer break. After the summer break, we're not going back to teaching our students face-to-face, which, it's the challenges that it triggers, whether it is for the professors or the students. So many changes are going on. I can also tell you that I have kids at home. I have 3 little kids at home. Similarly to my own university experience, they did not go to school since March, so they've been home for more than 3 months. 3 months at home without the option of meeting their friends face to face. Classes are being delivered through remote learning. Think about the not just the educational, but also mental health implications for those kids. You know, I had so many conversations with friends around losses, the losses of COVID-19, and you know, it obviously begins with the huge losses of life and job, but we frequently forget the tiny little losses that might seem minor, but are so impactful. You know, the kids that can't go to their classes, the kids who worked hard for a year to go into some sports event so that they could get a scholarship for their university, and now those sports events are not taking place, and they just can't go to study. So those are small examples, but the point is obviously that the ripple effect is incredible. Work is radically transforming and changing, right? More than 60% of employed individuals in the US and the UK have been working from home during the lockdown, and many of those would keep on working from home even when the gates open. Data is showing that employees are highly productive while working from home, which is very, very interesting, and making a lot of employers rethink the way they work with their employees. And the vast majority would like to continue working from home. Think about the impact of that, right? There are numerous ripple effects to those changes. Just a small example. This leads to increasing potential to disrupt the whole commercial real estate market, right? I don't know if you thought about that, but as more employees work from home, there's less overall need to own or rent office spaces, and bang, we have this whole new experience of real estate, and you know, there are a lot of social implications to such changes, and those are only examples, but they reflect the point that I'm trying to make, which is that we live in one of the most unstable and fluctuating periods of time in contemporary human history. I truly believe that this is the case, and such changes require tools for us to navigate wisely through this potential movement, through these potential changes. And I've chosen to link our current experience with mindfulness and meaning because I cannot think of better tools than mindfulness and meaning to guide us through those changes, right? We need a support system for ourselves, something to guide us through this process. And I wholeheartedly believe that the practice or the engagement with mindfulness and meaning are an incredible way for us to move forward in a way that is healthy, or at least as healthy as possible under the circumstances. So before we kind of dig deeper into that, let's start with the question of mindfulness. And the way I define mindfulness in the literature, you know, if I had $1 for every definition of mindfulness, I would have been a rich man. There are so many different ways to think about it and to approach it, and the literature is filled with all those different definitions. But my own approach to mindfulness is I believe in simplicity, and my approach to mindfulness is very simple. I believe that we experience and practice mindfulness any moment in life. This is my personal definition. Any moment in life in which our mind and our activity are one. Again, any moment in which your mind or attention or awareness and what you do are unified, they are at the same place, they are at the same space, then you are experiencing or practicing mindfulness. And just as a side note, this brings us into the whole discussion of formal versus informal practice of mindfulness, because we usually think about mindfulness in the context of its formal practice, as in, okay, I'm now dedicating time. I'm going to sit for 30 minutes and practice my breathing meditation, or I'm going to lie down before I go to sleep and do some body scan because I know that helps sleep. And those are formal practices of mindfulness, which are obviously very, very helpful. But I'm a huge fan of informal practice of mindfulness. And with informal practice of mindfulness, we integrate mindfulness into pretty much any moment in life, right? So when you bring your attention to the experience of taking a shower, and you feel the water on your body, and you feel the sensations it triggers, and you eat, and you really notice the food, and you make love, and you really experience the connection, and you have a conversation, and you really invested in the person you speak to, and so on and so forth. This is an informal practice of mindfulness, and I think it's a very powerful way for us to practice mindfulness. Now, in a normal state of consciousness, we are experiencing mainly mind wandering. So that's kind of in opposition to mindfulness. Most of us, most of the time, are experiencing mind wandering. What does that mean? It means that we have a duality, an experience of duality within the moment. So the duality is between our attention and the actual experience. So we would drink a cup of tea, and while the invitation in the moment is to kind of smell the tea, be there, present with it, our mind is with the conversation I need to have with my friend. I have a conversation with my friend, and my mind goes to the dishes I need to wash. Again, duality. I wash the dishes, and I'm thinking about the email I need to write. Bang! I break the unity of the moment into that duality. I'm writing that email, and I think about the cup of tea I'd like to drink, right? So we're in a never-ending cycle of that duality, of that brokenness of the moment, and what mindfulness is inviting us to do, and it's, you know, it sounds so simple. What mindfulness invites us to do is be there as something happens, right? This is it. Forget all the complicated definitions and all the ideas. This is mindfulness. Be there when something happens. Right? And yet, as simple as it might sound, the reality of it is very different. The reality of it is very challenging because our mind is conditioned, and, you know, I don't have the time to go into the whole kind of background and reasons and so on, but our mind is conditioned to fluctuate. It is conditioned to react. It's not conditioned to sit still and be with. And that's what triggers the never-ending cycle of mind wandering. Now, how does it all link with all of those changes that I've talked about? Okay, let's make the link explicitly between this idea or concept or practice of mindfulness and the challenges and the movement and the changes I've referred to. I wholeheartedly believe, in fact, I know that from my personal experience, from my work with clients, from my research, that in order for us to make wise decisions, at least one prominent tool that we need is mindfulness. And we need mindfulness to make wise decisions because we need to identify something that I think of or write about as the truth of the moment. What do I mean by the truth of the moment? Let's take, for example, two important areas in life, relationships and work. And think about those in light of this practice. So when we're in a relationship, and it really doesn't matter if we're talking about a friendship or a romantic relationship, each moment in which we engage with the other person is a moment that is filled with that interaction. And whatever's triggered by that interaction, it could be a feeling of content, disappointment, anger, joy, satisfaction, fulfillment. There are numerous internal experiences that could be triggered by that relationship. The question is, are you there, present, to identify those internal experiences? And in my language, can you see the truth of the moment? And that might seem, you know, that might seem like a trivial question, but I find it to be a profound question, because for most of us, most of the time, the answer is no. Nope, we are not there to identify that internal experience. We are not there to see the truth of the moment. Like whew, it whooshes over our heads. beyond our consciousness, or at least beyond the space in our consciousness that we can consciously identify. And we miss this data, right? If you know, I can imagine some of your researchers, imagine you would run a study, and the study is the investigation of your own life, and you would have to sorry, you would have to write the paper, reach conclusions, analyze the data without having the data, right? That's how I think of missing the truth of the moment and those internal experiences. This is the data with which we analyze our own lives to write a paper of our life, to reach the conclusions that are relevant and meaningful for ourselves. And to say, you know, this is an example to do with relationships. The same applies to work. As you engage with whatever you do as a profession, so many internal experiences are triggered, and so many insights could and should be derived from those experiences. And then the question, are you present to see and realize the truth of the moment within your experience at work? This could be applied to anything and everything. Yes, relationships and work, but anything within your experience of living life is relevant to what I'm describing right now. And this is a crucial question, because COVID-19 is throwing us all over the place with incredible challenges and opportunities. And in order for us to make wise decisions in relation to all aspects of life, we need that mindful attention. We need the truth of the moment to guide us through our decision making, right? We need the truth of the moment to guide us through our decision making. Or else it could be very easy to drift through this storm without an internal feeling of a compass that takes us in the right direction, even through those challenges and those powerful winds that could throw us all over the place. And that takes us into the topic of personal meaning and purpose. I consider meaning to be one of the most important aspects of our psychological well-being. I truly believe that. You know, if we think about the psychological variables that take us into a place of flourishing, that take us into a place of thriving, finding and having personal meaning and purpose is one of the most essential pieces within that movement into flourishing. I spent years doing therapy work with my clients while focusing around questions to do with their personal meaning. And frequently clients would come into the therapy room with other questions or other reasons that would drive them into the room. But when we dig into those questions, we find at the heart of those questions, we find issues to do with the simple question of why am I here? Why in the name of God am I here in this life, in this experience in which I wake up in the morning, and how do I feel when I wake up in the morning? You know, a lot of people wake up in the morning without an answer to the question, why am I here? And that has an immediate impact on their psychological well-being. We have endless data linking between lack of meaning in life and addiction, for example. And that makes perfect sense, because one of the things that people frequently describe when they talk about lack of meaning is an emptiness. This is something that I've heard so many times from my clients. They talk about emptiness, usually emptiness at the pit of the stomach, right? So when I don't have meaning, it's as if literally on a very experiential level, something inside of me is empty. And if I don't find healthy ways to feel that emptiness, in other words, finances to do with my personal meaning and purpose, addiction becomes an alternative in order to cover that emptiness, because that emptiness is a never-ending source of pain. Living with that emptiness is a very painful experience. And so knowing the answer to my personal meaning and purpose, that is a very empowering process. Yeah, Nietzsche once said, if you have the why, then you can deal with any how. I think it's a beautiful quote, because what the quote is trying to tell us is that when you have the why, when you know why you do something, then you can deal with any how. How can I do this? How can I deal with this? Well, if I know why I'm doing it, then I have the resources to deal with it. And I hope that while I speak, you have COVID-19, the whole pandemic, and all the challenges, all the changes at the back of your mind, right? So if there's a question of how do I deal with all those changes and challenges, do I have the why for that how? And if the answer is yes, then I will find the internal psychological resources to deal with those challenges, right? That's how powerful meaning and purpose are for us. So now with COVID-19, we need those resources, those internal resources, which means that we almost owe ourselves personal answers to do with the role we play during this crisis, our place in life during these challenging times, whether it is for ourselves or for others, right? Whether it is for our own personal psychological well-being, those around us, or others, strangers. How am I in service for others within that crisis, right? So those are the questions around personal meaning and purpose that are so powerful during this period of time. The thing about personal meaning, and it's very interesting, is that we tend to think about it like a rock. What do I mean by that? We think about it as something that we find at some point in life, and then we kind of position it within our lives, and this is it. The rock would stay there till the day that we die. And that's obviously not the case. I heard a lot from clients something similar to, I don't understand. How could it be for 10, 20, 30, 40 years, this job, this person, this hobby, this situation, it was so meaningful to me. It filled me with fulfillment. It was so right for me. And suddenly in the last few years, it disintegrated, and now it feels foreign. I'm disconnected from it, and there's a huge crisis around the loss of personal meaning and purpose around those different things. And this description from the client, it comes from the idea that meaning and purpose are a rock, and that they're supposed to stay as they were. But the truth is that meaning is not a rock. Meaning is a flowing river. It's a flowing river. It's a moving, never-endingly moving, flowing river. And life under COVID-19 is adding waterfalls and dangerous currents to our river of meaning, right? It's as if COVID-19 is this huge storm that is blowing above the river of meaning, and it's throwing it all around, which, as I keep on saying, feels challenging while offering opportunities at the same time. We need the presence of mindfulness to recognize changes in the flow of our meaning river. I'll say it again, because this is the only thing I would like you to take from my talk today. We need the presence of mindfulness to recognize changes in the flow of our meaning river, right? How do I make changes and adjustments within my river of meaning? Well, first I need to be in touch with that river. I need to sit at the banks of that river, which is such a huge thing. I frequently think if we would have, as a humanity, if we would have invested 10% of the time we invest on the internet, 10% every day, contemplating our personal meaning and purpose in life, as a society, as humanity, we would have transformed in incredible ways. But we don't, most of us, we don't sit at the bank of our flowing river of meaning. We don't we don't put our hand into that river, feel the water, taste the river, feel how it changes and how it feels to be in touch with it. This is so important. And mindfulness is an incredible tool for that presence, for that connection with the flowing river of our personal meaning in life. And so, in summary, there are so many lessons for us to take from the COVID-19 pandemic. Our social connections completely changed. Hundreds of millions of people lost their jobs. Many people start to contemplate more deeply their job, where they work, their health, their social connections, and other meaningful questions as a result of the coronavirus. In fact, I believe that the seeds are only now being planted, right? I think we're only planting the seeds now. This is just the beginning. The real explosion in our personal and social transformation will kick in after the pandemic. I always say to my current students at the university, I tell them, when you graduate in a few years, you will be working with the clients who will come to you with the content materials that were planted within them during the pandemic. So we're just planting the seeds now. And a lot of it will explode later on when we have the time to process the questions that we are now beginning to engage with. So this is a long-term process, a long-term journey. And the question is, what do we take with us within the toolbox of working with this journey? And while this is all currently confusing and challenging and frequently painful for many of us, I do believe it is also a wake-up call for us to ask the questions that are usually silenced by our fast-paced everyday life. And I cannot think of better companions for this question-asking process than the practice of mindfulness and meaning. Thank you. This is the end of my talk today. And
thank you, Itai. Thank you very much. Yeah, you're back. I think I'm just looking at the questions. There's a lot of thanks and gratitude for you. But I think you've been very clear. I don't see any questions, right? If you have written some questions, you can just write them again. If there are key stories of the truth of the moment and being present to it, I imagine would also provide moments of self-discovery because we are not distracted, what often takes us away from ourselves. Thank you, Itai.
Thanks, Dora.
So I think we are done for now. I think if we don't have any more questions, I mean, it's also, if there are any comments, just in general, it's been really nice having all those.
Dora, can you start your video?
Yes, I can start on the video. Is my sound okay now? As you can see, we are trying to, we have the image of an Icelandic waterfall here behind us, this is the waterfall that's on our website as well. Looking forward to take it to in 2021 or 2022, which conference you decide to choose. But thank you so much for being here with us at this webinar. I think we are living in a very interesting times, and there are lots of opportunities to explore what is happening to us, what is having an impact. I really love the quote of John Kabat-Zinn, say, we are losing the title of human beings, we are becoming human doings. Let's keep on being human beings. We want that. And we want to create a world where we all want to live in, for our children and for ourselves. That brings out the best in us. And as a reminder, kindness is contagious too. That is something that we don't want to prevent, but we want to promote kindness. And that is also, I was asked in one of the interview here when we were on an Icelandic television, if I just one wish, what would I wish for? And I hadn't thought about it, but as I said, I think the Beatles, they had it, love is all you need. And if, with more love and kindness in the world, I think it's going to be so much better. And I really do hope that we'll find a way to be more in the now, enjoying the moment, being less stressed, less focused on the future or the past, just be here. And also thank you for being here with us. Thank you for spending your precious time here with us. It's been really, it's been wonderful to look at these comments that you are sharing with us, sensing strongly that you are with us. We're all in this together, all with such a wonderful thing to be connected with people who also wants to make the world a better place. So thank you so much. And we really do look forward to be in contact with you when meeting you at the different events, conferences, and especially the ones here in Iceland next year in 2022. Thank you so much.